Honourable members, the prayer. Lord, the God of righteousness and truth, grant to our Queen and to her government, to members of the Legislative Assembly, and to all in positions of responsibility, the guidance of your Spirit. May they never lead the province wrongly through love of power, desire to please, or unworthy ideas, but laying aside all private interest and prejudice, keep in mind their responsibility to seek to improve the condition of all. Amen, and please be seated.
Introduction of visitors, introduction of guests, ministerial statements.
The Honourable the Minister of Health.
Well, thank you, Mr. Speaker. Now, all over the world, people have expressed their thanks to everyone who has helped keep us safe throughout the COVID-19 pandemic. Today, as we announce stage 2 of our relaunch, I want to add my thanks on behalf of our government to all the doctors, the nurses, first responders, and others who are protecting us and caring for us through the pandemic. I feel for the families who have lost loved ones. The pandemic has taken a tragic toll, especially on the elderly, and protecting them is the top priority for our relaunch strategy. But overall, we've come through the pandemic much better than most other jurisdictions so far for 2 simple reasons. The first is because Albertans are following the advice of the Chief Medical Officer of Health. They're doing the right thing and for the right reason, Mr. Speaker. Not out of fear of punishment, but because they see for themselves that it makes sense and it follows the evidence. And the other reason we've done so well is that our health system and first responders have done their job so well. The whole system, from Dr. Hinshaw and the staff at Alberta Health and AHS, to the frontline staff and physicians and community first responders. COVID-19 is a reminder of why I'm so proud of this health system. We've led Canada and the world in so many ways that it's hard to keep track. Testing, contact tracing, online self-assessment, modeling and capacity planning, procurement of PPE, ventilators, and other resources, real-time online case data, the Alberta Trace Together app, the staged relaunch plan and guidance on reopening for businesses and others, research, including the new biorepository, partnerships from the Birdie or eVent project to distributing masks at drive-thru restaurants, and now an orderly restart of scheduled surgery and other care. Most of all, the strength of this health system has been the same as it ever was, the skill and dedication of our staff and physicians. To take just one key example, our hospitals are among the safest anywhere because of effective infection control. To date, just 32 staff are believed to have acquired COVID at work and no physicians at all. That's not luck, it's good practice. And it doesn't just protect the staff and physicians, it protects patients, Mr. Speaker. It's a key condition for restarting scheduled surgery and for our relaunch overall. So to everyone in the health system and our community partners, on behalf of our government, thank you. We're in good hands, and we know you'll do everything possible to continue to keep us safe as we relaunch our economy. Thank you, Mr. Speaker.
The honourable member for Edmonton City Centre.
Thank you, Mr. Speaker. I appreciate the opportunity to respond to this statement from the Minister of Health. Of course, once again, we were not advised that this statement was going to be made, but that is the choice of the government if they do not want to follow that convention of the House. But I would echo the statements of the Minister of the Health. Indeed, we recognize the incredible work that our frontline healthcare workers have done throughout this global pandemic. They have truly been the heroes. From our family doctors, to our doctors in hospital, to our nurses, to our paramedics, to the frontline healthcare aides who have looked after seniors even under the most difficult conditions and often lacking the support that should have been there for them. They have stepped up and they have supported. And indeed, I echo what the minister had to say about Albertans choosing to follow the recommendations of our Chief Medical Officer of Health, Dr. Dina Hinshaw herself, a public healthcare hero, not only in the province of Alberta, but recognized and respected across Canada for her guidance and her leadership. And indeed, Mr. Speaker, it is because of their work that the Albertans have come through this as well as they have. The Minister of Health praised our public health system for its capacity and its work. But yet, this is a government that continually stands in this House and in the community and says that this very healthcare system is one where we pay too much and get too little. We have seen, Mr. Speaker, the value of a public health care system that has received the investment it needed. We were proud as a government over the 4 years that we were into to continue to fund for inflation and population growth, to stabilize what had been years of roller coaster funding under Conservative governments that had left that system often in chaos and uncertainty. But the stability that was provided, and indeed the hard work and dedication of all of our public health care workers, even when they themselves felt under attack and disrespected by their government, that they still stood and looked out for Albertans and in their communities, I salute them, Mr. Speaker. We will continue in the official opposition to support good initiatives to protect the health of Albertans. We will also continue to stand to offer criticism and suggestions of better ways to ensure that this incredible public health care system, which brought us through this global pandemic, our public laboratory system, which sadly may be up for auction soon, all of the aspects are able to continue and provide Albertans with the service and support they deserve. Thank you.
Member statements.
The honourable member for Lethbridge West.
No doubt the right-wing Wexiteer flank of the UCP caucus looks restive these days. It must annoy them the Fair Deal panel is delayed, which has been ready for weeks, according to one panelist. And of course, the constant reliance on Ottawa for everything from assistance to the oil and gas sector to support for small business also annoys, I'm sure. So the Premier's been given the right flank a bit of latitude in the hopes they don't wander off and start their own party. And so it was, Mr. Speaker, to the cheers of his colleagues that a UCP MLA rose yesterday to describe fellow Canadians as, quote, hostile parasitic partners who are trying to, I quote, strangle and suffocate Albertans. Interesting turn. The Premier clearly needs to allow a pressure valve for his Wexiteer MLAs, but this same Premier uses Justin will take care of it to respond to every query by Alberta small business, families and those who have lost jobs. Instead of helping Albertans, UCP government policy is to actually reach more into our pockets. They've raised our income tax, car insurance, property taxes, school fees, and as if that wasn't enough pocket picking for one fiscal year, they turned around to our federal taxes and dove into the first available loophole to get Justin Trudeau to pay for their party's operations. They've got their hands in every taxpayer's pocket they can find, including our fellow Canadians. So the Premier is trying to appease his separatist, curious MLAs by allowing them to say impolitic things about our fellow Canadians. But the real agenda? Take Ottawa's money. It's almost as if this Premier has more faith in Ottawa than he does in Albertans. But here's the thing. If you're going to insist that you don't need to lift a finger to help Albertans because the feds are there to do it for you, you don't also get to take other Canadians' money and insult them while you do it. To help with all this, the UCP could just repay the money they took from federal taxpayers. That might actually help to appease Albertans, who are increasingly annoyed at all these UCP hands in all of our pockets.
The honourable member for Lexington Parkland.
Thank you, Mr. Speaker. A few weeks back, the NDP were all wild-eyed and scared to come back to work, as you may recall. Well, they're feeling better now because they're back on that fear and smear campaign. The members opposite continue to misrepresent the facts to Albertans despite it being repeatedly corrected in this House. The most recent target, the Alberta Energy Regulator's decision to defer some environmental reporting. Members opposite, including the NDP leader, continue to state in this House in public that there is no environmental monitoring taking place across the oil and gas sector. These statements are completely false and absolutely, utterly ridiculous. The AER, an independent arm's-length regulatory body, established two guiding principles to balance worker safety, public health guidelines, and environmental stewardship during COVID-19. Firstly, exemptions would be low risk for potential short-term impacts. Secondly, must be noted that public health orders pose a challenge to completing normal monitoring activity. Companies continue to regularly monitor surface water and groundwater quality. All emission controls and regular air monitoring programs remain in place. All wildlife deterrence mitigations remain in place. Again, Mr. Speaker, in this very House and telling community members opposite are telling people that there are no wildlife protections in place, even though they know this is a complete fabrication. It's clear the NDP have taken a page right out of the socialist playbook. If you repeat it enough times, it'll make it true. Furthermore, repeatedly spreading misinformation and falsehoods in such scale damages Alberta's reputation. Environmental and social governance is an important factor in the international investment community. Alberta is actually a leader in ESG. It is really disservice to Albertans. The NDP spends so much of their time and energy to try to score cheap political points while chasing oil and gas investment out of this province. Maybe the NDP is still mad about their social license, or maybe, just maybe, this ongoing campaign is to degrade Canada's energy industry is simply an obligation to the LEAP manifesto. Perhaps if they watched Planet of the Humans, they'd have their eyes opened. To the NDP, how about working with us to get the economy going again and stop your childish games?
The Honourable Member for Peace River has a statement.
Thank you, Mr. Speaker. I'm honoured to rise today to speak to an important issue to the constituents in my riding of Peace River. The success of the government's Skill for Jobs agenda, which is a robust plan to get Albertans back to work and grow our economy. Alberta faces the dual challenge of COVID-19 pandemic, collapsing demand in oil, and predatory price war in global oil markets at the same time. Both have wreaked havoc on our economy, and Albertans are suffering because of it, Mr. Speaker. That's why this government is committed to creating opportunities for young Albertans to learn practical job skills that meet the demands of our labour market today and will help them succeed and build prosperity for all Albertans tomorrow. As part of that commitment, Mr. Speaker, our minister has been busy. He's created a $1.5 million Alberta High School Apprenticeship Scholarship, focusing on trades in our youth and in our schools. Invested $10 million over 4 years to Women Building Futures to support women who want to pursue opportunities in the skilled trades. He's added even more funding to the Skills Canada Alberta and Careers Next Generation programs. And in 2023, this government will commit $6 million a year, Mr. Speaker, to that program. Our government is taking real concrete action to help Albertans get jobs and move forward in life. Mr. Speaker, we have also established the Skill for Jobs Task Force to strengthen and expand apprenticeship education in Alberta. Our government, Mr. Speaker, firmly believes that apprenticeship learning and skilled trades has every bit as much value, worth, and merit as a university education. And Minister of Education is still committed to the new performance-based funding model next year. Although delayed, Mr. Speaker, this is an important part of having sustainable education in the future. My priority, Mr. Speaker, for my part, is to train Albertans in my own riding for jobs that not only align with what the market is asking for, but also provides fulfilling, long-term, meaningful employment for families. Mr. Speaker, Alberta needs working Albertans. That's why the Alberta government has a credible plan to get Albertans back to work.
Hear, hear.
The Honourable Member for Calgary-McCall.
Thank you, Mr. Speaker. The Black Lives Matter protests following the death of George Floyd have reached every corner of the world. People and institutions are vocalizing their support for the movement and against systemic racism in our society. Yesterday, I asked the government why their statement on this very issue didn't denounce racism specifically against Black community, and why the Anti-Racism Advisory Council's full statement was silenced. I also asked how the government was planning to learn from the movement and about their plans to engage with the Anti-Racism Council and their support for anti-racism initiatives. These questions are top of mind for many Albertans, including in my riding. And they are important questions because since taking office, this government has cut funding for anti-racism grants, community initiative program, and for decade-old Alberta Human Rights Education and Multiculturalism Fund that supported Alberta hate crimes committees since 2002. However, we didn't get any answers. Also, yesterday it was reported in City News that the Premier was asked by a journalist, and I quote, "What are your thoughts on these Black Lives Matter demonstrations? And moving ahead, what role will the province play in addressing systemic racism in Alberta?" Mr. Speaker, it's unfortunate that Premier was not able to point to a single step or action his government is taking or intends to take to address systemic racism. Instead, the Premier went on lecturing about how to protest. Mr. Speaker, I want to say addressing racism is a partisan issue which requires us to take a stance and tell Albertans where we stand. I know, Mr. Speaker, on this side of the House, We stand firmly against systemic racism and have committed to listening to Black communities and marginalized communities to address this issue. And I suggest that government do the same because, as Dr. King says, there comes a time when silence is betrayal.
The honourable member for Banff-Kananaskis.
Thank you, Mr. Speaker. It's now been 90 days since the World Health Organization declared the coronavirus a pandemic. Since that day, we've seen an unparalleled shift in our ways of being. Our identities, which were so entrenched in our jobs, our friends, and our extracurriculars, were stalled. Our province was quick to act, to do what we believe needed to be done to protect the health and financial security of those living in our province. Alberta, Canada, and the entire world were forced to stand still. When we as a province presented our modelling on April 8th, it showed a terrifying potential spread of this virus. Evidence gathered from other outbreaks informed that modelling, and the scenarios helped us prepare for the potential impact of a pandemic and its peak. Our probable scenario was comparable to other countries. Our modelling showed 800,000 infected from 400 to 3,100 deaths. What we actually saw was only 7,000 cases, 6,700 of which fully recovered. We were prepared for the worst. We had respirators and the PPE, and we were ready to shelter in the storm together. But now that the worst is definitely behind us, we see the modelling that was presented to us months ago remains well below even our lowest projected numbers. Albertans stood up and we flattened the curve. But there will be unintended consequences of this pandemic in the future. We're starting to see them already. Albertans have been hard. Small businesses have been hit hard. However, without reopening industry, things are not going to get better anytime soon. So now it's time that Albertans return to a province of freedom and self-determination, one with grassroots thought and decision-making. That is why we are accelerating the phase 2 relaunch and why we are opening faster and earlier than originally thought. This will help us build back our province together. Albertans have already shown that we are the best under pressure, and we are strong when we stand together. Mr. Speaker, flattening the COVID-19 curve was only our beginning.
The honourable member for Calgary Mountain View has a statement to make.
Thank you, Mr. Speaker. A few years ago, the future of the Green Line looked bright. All 3 levels of government were committed, and then the UCP backed out. Since then, Calgary has gone through a municipal election where the Green Line became a central issue, and in that election, Calgarians resoundingly chose to build the Green Line. But there are some who are unwilling to accept the democratic will of the people. This includes a group of wealthy UCP insiders that has given tens of thousands of dollars to the UCP directly and to the Premier. And it also includes the UCP's own commissioner looking into the funding of environmental organizations. Last June, this group of UCP insiders started a campaign to kill the Green Line. And less than a month later, the Premier suddenly had a change of heart. Suddenly, he was okay with stopping the Green Line. And in last October's budget, the Premier drastically cut funding, but assured everyone it was coming later. Just trust him. Since then, the campaign to kill the Green Line has only intensified. The UCP-aligned group has launched a full-blown campaign to stop the project. Meanwhile, the Premier and his government have been silent. When the Green Line was first announced, it was said, quote, "It's difficult for municipalities alone to finance this kind of expensive, modern, cutting-edge infrastructure. Together, with our municipal and provincial partners, we will ensure Calgary has the rapid transit infrastructure to make this a dynamic city to move into the future." That was then Federal Minister, now UCP Premier, in 2015. I wish the Premier would listen to his old self and stand up for this project that will build a modern economy and create 20,000 jobs for Calgarians.
Honourable members, we are at oral question period, and the honourable member for Edmonton City Centre has the call.
Thank you, Mr. Speaker. Healthcare in rural Alberta is in danger. Doctors are leaving, clinics are closing, families are worried. And what is the Premier's office telling rural Alberta families like the ones in Crossfield who are losing their family doctor? Suck it up. Drive to the city. What this Premier doesn't get is when they leave the town for services, they are also going to leave the town to do their shopping. Families will take money out of their community, and that is what destroys rural Alberta. Why is the Premier telling Albertans that to give up on having a family doctor in town and thus give up on their communities?
The Honourable the Premier.
Mr. Speaker, I would remind the honourable member that Alberta has the highest per capita number of physicians in Canada by a country mile. We have the best compensated physicians in Canada. We have the most generous incentives for physicians to locate in rural communities in Canada. The number of physicians serving in Alberta has grown over the past year. And the minister recently announced an additional package of incentives to encourage physicians to stay and locate in rural Alberta.
For Edmonton City Centre.
And yet, despite those incentives, Mr. Speaker, they continue to leave. I quote, "For those of us from Airdrie, the worry and fear is that we will not make it in time. Will the baby be born on the Deerfoot on our 45-minute commute, or will my child die?" That's the member for Airdrie East, which is closer to Calgary than Crossfield. Mr. Speaker, there's a lot of communities closer to Calgary than Crossfield. There's lots of communities within 50 kilometers of Edmonton, Red Deer, and Lethbridge. Why does the Premier think it's acceptable to tell rural Albertans to drive farther, wait longer, and risk more to access health care services?
The Honourable the Premier.
I reject the inaccurate preamble to the question, Mr. Speaker. I would remind the member opposite that under the last year of the NDP government, 27 rural doctors left their service in rural Alberta. That since then, Government of Alberta has added a package of monetary value of some $80 million to incentivize rural physicians. That is for about 800 rural physicians. That averages about $100,000 per physician, Mr. Speaker. While the NDP allowed costs to go uncontrolled, we are ensuring that we can manage costs while incentivizing additional service in rural Alberta.
The Honourable Member for Edmonton City Centre.
It's doctors, Mr. Speaker, that said their gift is akin to a bank robber giving a little bit back and calling it a charitable donation. Quote, "When I was in grade 3, our family doctor left. This created some struggle, and it took us nearly 5 years before we could find another family doctor. We celebrated when we got that new doctor, but they left 2 years later. By the time I was in grade 9, I gave up on the idea of having a family doctor." That's the member for Fort McMurray-Lac-La-Biche, a community also losing doctors. Mr. Speaker, why is this Premier telling his own rural MLAs who've lived through this very experience and spoken about it in this House to tell their constituents they should also have to give up on having a doctor?
The Honourable the Premier.
Mr. Speaker, the member opposite is talking about bank robbery for a category of people who, on average, bill approximately $400,000 per year in Alberta, in this province, 20% more than the average across the country. And happily, they also enjoy the lowest income taxes and much lower cost of living than in comparable major provinces like Quebec and Ontario and British Columbia. Mr. Speaker, there's always a shift in terms of the number serving. Net overall, the province gained 293 physicians in the last fiscal year to March 31st.
The Honourable Member for Calgary-Buffalo is rising with a question.
Thank you. This government has failed to properly support small businesses during Phase 1 and now Phase 2 of the COVID-19 relaunch. In fact, only 50% of Calgary businesses that have reopened are fully operating. And this UCP government has offered only deferred bills and small grants that don't measure up. The owner of Calgary's Nico's Bistro said yesterday, quote, "When it comes to September and October, I'm scared." To the Premier, approximately 40% of businesses are telling you they might not survive, and they're telling you they're scared. Please tell us what else you're going to do to keep our small businesses running.
The Honourable the Premier.
Well, Mr. Speaker, I can totally understand the anxiety of small businesses given that we are, as a result of this global pandemic and a collapse in our largest industry, we are facing the most challenging year in our economy since the 1930s. And that is why our government has responded with unprecedented ambition, committing $14.6 billion to date in cash support, in deferrals and in liquidity measures to support families and Alberta job creators, including the $200 million relaunch grants to small businesses announced last Friday.
The Honourable Member, Calgary-Buffalo.
Ambition doesn't pay the bills for small businesses. It took this Premier 57 days from our caucus calling for more small business supports for him to do the bare minimum. Businesses are speaking out and telling this government that covering the costs of hiring staff and buying PPEs are not sustainable. But this government is still failing to listen and respond. But while the government leaves Calgary businesses hanging, they had zero problem leaping through the nearest loophole to subsidize their party fundraisers. Does this Premier even care that businesses are telling him they need support, or now that his party staff have their money, has he pulled out his earplugs or left them in?
The Honourable Premier.
Mr. Speaker, while the NDP offers nothing but insults, this government is offering concrete support to protect Alberta families and job creators during this unprecedented time of trial. I would remind the member opposite that when he was the worst finance minister in our province's history, he imposed a carbon tax that he hid from Albertans in the previous election that cost the average small business $4,000 a year. We scrapped that tax, Mr. Speaker. He imposed a 50% increase in the minimum wage for small and medium-sized businesses during a recession, which continues to be the single largest complaint about small business people in terms of struggling in today's economy.
Hear, hear. Honourable member.
Thank you very much, Mr. Speaker. We reduced the small business tax to 2% with that carbon tax. And Mr. Speaker, he actually put earplugs in. For weeks, our NDP opposition has been calling on this government to ban commercial evictions during COVID-19. Alberta small businesses are reporting that they're only earning 15% of the revenue that they were in March. Now some fear they're going to be evicted altogether. The Premier hints at legislation, but wavers when asked about implementing a full commercial evictions ban to the Premier. Why is it always half measures with you? The businesses in Calgary, the businesses right across this province need your full support right now.
The Honourable the Premier.
Well, Mr. Speaker, one thing is for certain, it was never half measures when he was finance minister. It was a full-on attack on businesses, on employers, and on the Alberta economy. Higher business taxes, the carbon tax, higher income taxes, higher property taxes, higher red tape, higher labor costs, higher everything, which led to the jobs crisis that this government had to inherit. In terms of rent protection or eviction protection, we'll be bringing forward legislation in that regard. And on the first day that the federal government announced the Canada Emergency Commercial Rent Assistance Program, this government committed the full $67 million to it.
Hear, hear. Order. The Honourable Member for Edmonton Glenora.
On Saturday, Casey and Tom J. wrote the Premier and they said, quote, "It has not been easy, especially for Tom. He is autistic and legally blind. He misses his teachers, friends, and teachers' aid a lot. Since you guys cut funding to his education assistant, I've been filling in the role as his aide while working on completing my high school classes and working part-time as a cleaner," end quote. The Premier has harmed this family with his cuts. Will he do them the courtesy of writing them back personally, and what will he say?
The Honourable the Premier.
Well, the first thing I would say, Mr. Speaker, is that Albertans support children with special needs. I would secondly say they should not listen to the disinformation of the NDP, because in point of fact, funding for education has increased under this government. You only need to look to page 122 of the budget to see the highest level of spending in Alberta history, the highest per capita spending in the country. In terms of special needs, Mr. Speaker, unfortunately, schools were suspended on March the 17th because of the pandemic, and so the normal access to special needs teachers was no longer available, but happily the schools will be opening in the fall.
The Honourable Member for Edmonton Glenora.
Casey, who identifies as a Calgary High School student, goes on to say, quote, "Tom and I told our parents, teachers, and school principal that we don't want anyone who has hurt us this year, including all of the UCP MLAs, the Minister, the Premier, at our graduation," end quote. This family didn't get a choice about the UCP taking their tax dollars to pay their partisan political staff, but Premier, Tom and Casey should get a say in who attends his graduation this year. Will you apologize for your minister's letter and retract her threats?
The Honourable the Premier.
Mr. Speaker, you know, one thing I can observe is that in this time of extraordinary trial, Albertans have pulled together with one notable exception. This party opposite has been criticized by commentators, objective commentators nationally, for being the most divisive in the midst of this crisis. Case in point, the minister simply said to school boards that aldermen, mayors, members of parliament, members of the legislature are always welcome at public school graduation ceremonies. They're not required to be there, but it's part of our democracy, Mr. Speaker.
Order, order. The Honourable Member for Edmonton Glenora.
Thank you, Mr. Speaker. The letter from these students to the Premier ends with this quote: "We don't feel safe with your presence at all. Please don't come." End quote. Premier, you and your minister have done real harm to this family, and they are telling you this directly. Why are you trying to force your way into Tom's celebration instead of respecting the wishes of this student who has special needs?
The Honourable the Premier.
Mr. Speaker, I'm doing no such thing, and the nature and the tone of that question speaks for itself, and the nature of that member who once referred to Albertans as being sewer rats. Mr. Speaker, that is a member who brings into this place a habit of division, derision, and defamation. Mr. Speaker, she should be ashamed of herself. She should apologize for her conduct in Alberta politics.
The Honourable Member for Edmonton Riverview has the call.
Thank you, Mr. Speaker. Albertans were horrified by the loss of life at Mackenzie Town Continuing Care Facility in Calgary. But now another major tragedy is unfolding at Extendicare Hillcrest, also in Calgary, where 20 seniors have died from COVID-19. That's even more than the 19 that died at Mackenzie Town. The families of these Albertans deserve answers about what went wrong and why. Premier, have you been briefed about the outbreak at Extendicare Hillcrest? And can you tell this House why so many lives have been lost?
The Honourable the Minister of Health.
Thank you, Mr. Speaker, and my heart goes out to all Albertans who have lost a loved one during this pandemic. I would say this, that before the pandemic, we were doing a review of continuing care legislation, all 6 acts and 6 regs, 3 different standards of care. And we've now wanted to use this as an opportunity for us to also review the response to the pandemic and what we can do to continue further, not just legislatively, but also how the system can be designed to take care and take better precaution for the most vulnerable. And so I'm looking forward to the Honourable Member from Calgary-Fish Creek and chairing that review and coming back to us with recommendations.
The Honourable Member for Edmonton Riverview.
All of the deadliest outbreaks in Alberta have been in privately operated continuing care facilities. This government was slow to respond with sufficient PPE, site staffing. In fact, the government admitted that some seniors in Alberta are still being cared for by workers who are moving from site to site to site, almost 2 months after the rule was supposed to be in place. Premier, will you personally guarantee to all Alberta seniors that they will have the single-site staffing protection you promised them by the end of the week?
The Honourable Minister of Health has risen.
Mr. Speaker, I find it disappointing that because this question has been asked before, and that the members of the opposition, including the Honourable Member who's asking the question, continues to attack the orders of the Chief Medical Officer of Health, and in particular for the 4 sites out of our 400. We have 400 sites throughout the province, Mr. Speaker, and there are 4 sites which were provided an exemption by the Chief Medical Officer of Health. And we see, instead of giving deference to the professional and medical advice of Dr. Hinshaw, we continue to see it being attacked, and I find that incredibly disappointing, Mr. Speaker.
The Honourable Member for Edmonton Riverview.
A growing number of Alberta families are heading to court to find justice for their loved ones. They know that the system failed. But not everyone has the time or money to pursue a protracted legal battle with large corporations who make hundreds of millions of dollars in annual profit. All Albertans deserve to know the truth and to know that the province has acted to ensure that these outbreaks will be prevented in the event of future waves of COVID or another virus. Premier, will you give these Albertans the public inquiry they're asking for?
The Honourable Minister of Health.
Mr. Speaker, I think I've said this before. I know the Honourable Member sticks to her notes, but the answer was answered, or the question was answered in my first answer. We are using our review of the continuing care system and the legislation to be able to review the system as a whole and how we can learn on how the system can be designed to take care of our vulnerable. And as I said, Mr. Speaker, my heart goes out to all Albertans who've lost a loved one, in particular those who have been lost, who've been residents in our continuing care facilities. But, Mr. Speaker, it's important for us to remember the context that both Ontario and Quebec have lost.
The Honourable the Member for Lethbridge East is rising with a question.
Mr. Speaker, it's been obvious to all observers that the COVID-19 infection curve has flattened, and our healthcare system is not overwhelmed. That's why I was pleased to see that we are accelerating our relaunch and that Stage 2 businesses can begin to open as soon as this coming Friday, June the 12th. It's obvious that the government put a lot of forethought into this decision. Can the Premier tell the House what led to the decision to move to Stage 2 early?
Well, the Premier.
For the thoughtful question, Mr. Speaker. Fortunately, thanks to the tremendous resilience and responsibility of ordinary Albertans across the province, we have flattened the curve. We have exceeded our expectations in every respect in the fight against COVID-19. We have only 355 active cases and 44 people with COVID in hospitals across Alberta. This is a decrease of almost 70% in active cases since May 14, when we started phase 1 of the relaunch. And so, Mr. Speaker, we've met all of the criteria to move forward, advancing phase 2 to June 12 and advancing many items from phase 3 into phase 2.
The honourable member for Lethbridge East.
Thank you, Mr. Speaker, and thank you to the Premier. Stage 2 has led to more industries and more businesses opening, and some businesses that were already opening are seeing their restrictions loosened. The announcement this morning also includes some businesses that were originally scheduled to open in Stage 3, such as gyms. Can the Premier tell this House whether consultation was done with these organizations and whether they will be ready for Stage 2?
The Honourable the Premier.
Yes, Mr. Speaker, I can't guarantee that 100% of the individual businesses will be ready, but I can say that with respect to gyms and many other sectors, I want to thank them, first of all, for their remarkable patience, the sacrifices they have made, but secondly, for having brought forward very specific and constructive guidelines to Alberta Health on how they could operate safely. So not only will gyms be open at phase 2, but libraries, more surgeries in the health system, wellness services like massage, acupuncture, reflexology, personal services, indoor recreation, theaters, community halls, team sports, pools for leisure, etc.
The honourable member.
Thank you, Mr. Speaker, and thank you again to the Premier. It's obvious to all members of this House that Albertans want the economy to reopen and that their hard work has led to our province being able to open faster and earlier. But we all know that the fight against COVID-19 is far from over. Can the Premier tell the House what precautions our government is taking to limit infections and whether Albertans need to continue to take precautions to limit the spread?
The Premier has the call.
Albertans do have to continue to act responsibly, follow the public health guidelines. Mr. Speaker, we don't want people wrongly getting the impression that this is all over and that we're fully back to normal. I wish that were the case, but it cannot be at this stage. And so there are still limits, for example, on social gatherings at 50 people indoors, because those have proven to be very high vectors for transmission. There are limits to outdoor gatherings of 100. And we ask people to look online, but most importantly, follow the basic hygiene protocols, frequent washing of hands, and physical distancing wherever possible.
The honourable member for Edmonton Highlands Norwood has a question.
Evidence is clear that women are bearing the brunt of the pandemic. Last month, across the country, women only regained 30% of the jobs that were created, even though they make up 50% of our population. To add to this, the UCP government's attacks on the public sector also disproportionately hurt women. To the Premier, what are you doing to ensure that your mostly male panel, has a plan for an economic recovery that centres the needs of women?
The Honourable the Minister of Culture, Multiculturalism and the Status of Women.
Thank you very much for the question. I think it was a question. I would like to very much thank the panel that is working on economic recovery. I'm fairly certain that I can, without any bias, suggest that the folks that are on that panel, which is made up of men and women, are very focused on the well-being and the economic ability of all people in this province, right across. The wonderful thing about having a group like that is that it's one piece of the puzzle. They don't work by themselves. They work with absolutely every organization.
The honourable member for Edmonton Highlands Norwood.
Given that thus far this government has not allocated a sufficient amount of money towards ensuring that childcare operators will be able to get through this pandemic, and economists of all stripes argue that childcare is an essential pillar of any successful economic recovery, to the Minister of Children's Services, what are you doing to ensure that affordable, accessible, quality childcare is a key part of your government's plan for economic recovery? And please be specific.
The Honourable, the Minister of Children's Services.
Thank you, Mr. Speaker. What we are doing to address those needs is listening to parents and childcare operators across this province. Mr. Speaker, we've hosted 6 teletown halls with childcare centre operators and preschools right across this province to hear what their needs were. They had asked for around $18 million worth of dollars to be redirected to support them through the pandemic so that they're able to open up and support families as parents get back to work, and that's exactly what we've done.
Member for Edmonton Hines Norwood.
Given that the Alberta Sexual Violence Hotline saw a 57% rise in the number of calls during the first month of the pandemic, and experts and frontline workers are expecting this number to only continue to rise in coming months as the economy opens up. To the Minister responsible for status of women, before the pandemic, Alberta already had the 3rd highest rate of domestic violence in the country. What are you doing to address this increase in domestic and sexual violence?
The Honourable, the Minister of Culture, Multiculturalism and the Status of Women.
Thank you very much, and thank you for the important question. We've actually had the privilege of meeting with many of the associations, especially during COVID. One of the things that we realized is that all of us needed to stay home and stay safe, but we realized very quickly on that home was not necessarily safe for people who are suffering from domestic violence and sexual assault. This is why we actually saw an increase in the numbers going to the one line. As a result of that and discussions actually with the federal minister, we're looking at potentially even expanding that line nationally as a result of the good work that is being done by our associations.
The Honourable, the Official Opposition House Leader.
Mr. Speaker, in May of last year, Edmonton EMS responded to 108 opiate emergencies, while this May, EMS responded to 246 cases, more than double. One day alone last month saw 16 emergency calls. EMS Public Education Officer Alex Campbell said, and I quote, "We only see the worst in the worst calls, and we know that there's been a large number of activations of the community-based naloxone kits." What is the Associate Minister of Mental Health doing right now to address this concerning and tragic growth in opiate overdose, and why is it taking so long to respond?
Honourable, the Associate Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. Last week, I met with officials from George Speedy Center and Boyle Street in Edmonton. We spoke to the frontline people who are working with this, and my heart goes to all of their hard work and also the first responders responding to the COVID-19 request. Mr. Speaker, our government responded with the most comprehensive response, with $53 million comprehensive package, make it available for Albertans 24/7, no matter where they are, they can access services.
The Honourable Official Opposition House Leader.
Thank you, Mr. Speaker. Given that in April there were 676 reported overdose reversals through the community-based naloxone program, the highest number in more than a year, and given that Marlis Taylor, the director of Street Work, said, and I quote, "I've been a nurse in the inner city for 25 years, and I've never seen anything like this, ever." And given that the only response from the Associate Minister so far has been note that the first opiate surveillance report is expected to be released next week, can the Associate Minister of Mental Health explain why he's waiting for a report when lives are on the line?
The Honourable, the Associate Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. It's important to understand that the dangers of consuming illicit drugs are very dangerous, and that's why our government put lots of support services available to help people to get out of addiction. Mr. Speaker, I'm proud to share with our House that we tracked 5 quarters of the fatal report for opioid crisis. We are cautiously optimistic that the number has been steadily going down. But with COVID-19, we anticipate that there will be some increase coming.
The Honourable, the Official Opposition House Leader.
Thank you, Mr. Speaker. Well, given that you anticipated that it would go up with COVID, I would hope there would have been a strategy. And given that this minister and the government have troubling history of attacking harm reduction, and given that the doubling of emergency opiate cases have doubled since last year, and given again that Marlis Taylor from Street Works noted that the last 2 weeks were notably bad for overdoses, and given that Taylor, who is again the nurse for 25 years, quoted, "It just feels really deadly out there for people." And given that despite these increases, there's been no action from the minister, why won't the minister act? Is he waiting for them to triple, to quadruple? What's going on?
The Honourable, the Associate Minister of Mental Health and Addiction.
Speaking of track record, this previous government failed Albertans with one-pillar approach that did not help any Albertans get out of attraction, but managing an ever-increasing population. Mr. Speaker, we will have no hesitation to tell Albertans that our government will be laser focused on helping people get out of addiction We have a recovery onto the continuum of care. We're proud to lead the nation on this. In the coming weeks and months, we're happy to report more to the House for our program.
The order, the honourable member for Banff, Kananaskis.
Mr. Speaker, the COVID-19 pandemic has uprooted our province, our economy, and all sense of normalcy. But it's time to face the facts. The COVID-19 curve in Alberta has been flattened. In fact, the modeling presented to us months ago never even reached the best case scenario numbers, never mind the worst. So after months of economic hardship, lingering fear, and rates of unemployment that should terrify us, the people of our province need a morale boost. And I believe it's time we allow more businesses, including the many who were forced to stay closed during phase 1, to properly reopen. So to the Premier, with only 0.01% of our province actively ill, isn't it time we accelerate phase 2?
The Honourable, the Premier.
Yes, it is, Mr. Speaker, and that was the announcement that I made with the Minister of Health and Dr. Hansard earlier today, that we are moving forward earlier than expected with phase 2 relaunch and more broadly than planned. It will begin this Friday, June the 12th. Earlier we'd indicated it would be no earlier than June 19th, and that's because those numbers the member cited didn't happen by accident, Mr. Speaker. They didn't happen by massive over-intervention. This province took a lighter hand in terms of public health restrictions than almost anywhere in the developed world, with better results. Kudos to Albertans.
The honourable member for Banff Kananaskis.
Thank you, Mr. Speaker, and thank you, Premier. That's great news. Well, we have also received an outpouring of cries for help from small businesses who are unable to make ends meet with their doors forced shut while their rent payments, bills, and inventory costs pile up. But given the best support we can give small businesses right now is an endorsement to reopen and resume operations without governmental overreach and regulation, but rather effective guidelines and supports. To the Premier, what all businesses can we now expect to see open with phase 2?
The Honourable the Premier.
Speaker, first, on the first point, on Friday, I joined the Minister of Economic Development, Trade and Tourism to announce our $200 million commitment to the small business relaunch grants, the details of which will be forthcoming, as well as legislation for some form of commercial rent protection, in addition to the $14.6 billion of fiscal action taken by this government to offer liquidity and cash and other forms of support. But as I mentioned, there's a long list of additional businesses. We ask people that will be able to operate as of June 12th. We ask people to go to the Alberta BizConnect website to see that, as well as the guidelines for safe operation.
The honourable member.
Thank you, Mr. Speaker, and thank you again, Premier. Well, given that many people I talk to, and truthfully myself included, don't want to return to a new normal, but honestly want to return to the old normal, where we live with resilience and without fear, where we exercise self-responsibility rather than relying on the government to guide our every action. The economic repercussions of COVID-19 will be long-lasting in Alberta, as will the financial repercussions. So lest the financial economic ruin be the legacy of our generation, when can we now expect to hear more about the findings and recommendations from our government's appointed economic recovery panel?
The Premier.
This is an absolutely critical question. As I've said from day one, this challenge is not just to save lives, but also livelihoods in the face of the largest economic contraction in 8 decades, Mr. Speaker, and the double whammy of the collapse of energy prices in Alberta. The government, including the Minister of Finance, will be coming forward with Alberta's economic Alberta's economic recovery strategy. But today's announcement is an important step in that direction. And Mr. Speaker, we will build on the profound advantages we have as a province, our fiscal advantage, the advantage of our young population, our diverse population in that strategy.
The honourable member for Edmonton Millwoods.
Thank you, Mr. Speaker. Teachers, custodians, municipal construction workers are just a few of the workers who are going to have their pensions managed exclusively by AIMCO because of the decisions of this government. Yesterday, the Minister of Finance told this House that AIMCO provided, and I quote, excellent returns. He boasted that AIMCO beat the benchmark 8 out of 10 past years, but he's picking the wrong measure. Among active public investment managers, AIMCO is one of the worst performers. So to this minister, do you still stand behind the comments you've made repeatedly in this House?
The Honourable the Premier has risen.
Well, the minister's absolutely right in the historic performance of AIMCO. Mr. Speaker, however, the member in her questions betrays the economic illiteracy of the NDP. They love to scare folks in the public sector about the viability of their pensions. But, Mr. Speaker, let me say this very clearly to the member. These are government-guaranteed, defined benefit pensions. The benefits are unrelated to the returns achieved by the investment management agency, Mr. Speaker. I regret that the economic illiteracy of the NDP finds it impossible to grasp.
The Honourable Member for Edmonton Millwoods.
Given getting good returns is important for these pensions, and given that the Institutional Investor, the leading publication in Wall Street, has yet another piece on AIMCO's volatility-based investment strategy that resulted in Albertans losing billions of dollars, given they quoted a hedge fund manager saying, Canada is definitely known for having some of the most sophisticated players, and CPPIB is known for being one of the best. By being in Canada, AIMCO piggybacks on that reputation. Why does the minister think he can gamble with these retirements?
The Honourable, the Minister of Finance and the President of Treasury Board.
Well, thank you, Mr. Speaker. And as the Premier just noted, the public sector pensions in Alberta are government-backed, government-guaranteed pensions. These are pensions that have a defined benefit. The benefit will be there for public sector workers in the future, guaranteed. Mr. Speaker, we continue to believe and have confidence in AIMCO's ability to deliver high-quality returns for pension holders in the future.
The Honourable Member.
Mr. Speaker, given that Albertans are appalled that this minister hijacked their pensions, no discussion, no consent, and given that the reason for forcing Alberta pensions to AIMCO is their purported excellent returns, and given that we now know the minister was cherry-picking the data and AIMCO is amongst the worst performers relative to its peers, will he agree with the millions of Albertans who have complained about their hijacking of the retirements that this issue deserves a real debate in this place about these pension changes?
The Minister of Finance.
Well, thank you, Mr. Speaker. I just want to remind the members opposite that the motivation to consolidate pension management functions at AIMCO is to benefit from economies of scale. There's an abundant amount of research out there that shows the larger the funds managed, the lower the cost to manage those funds. Mr. Speaker, in the long term, the changes we made to public sector pensions will serve Alberta public sector workers well and Alberta taxpayers well.
The Honourable Member for Edmonton Whitemud has a question.
Thank you, Mr. Speaker. Yesterday, this government announced they would be launching invite-only consultations for the childcare sector after scrapping the accreditation process abruptly in March. At a time when the sector has been asking for substantial financial supports to prevent them from collapsing, and parents don't know if there will be affordable childcare for them when they need it, all this government has to offer is an online survey about red tape reduction. To the minister, do you commit to releasing a written report with raw data from these consultations, or are you going to continue to be the most secretive government in Canada?
The Honourable, the Minister of Children's Services.
Thank you, Mr. Speaker. Let's be clear. Under the former government's pilot project, $45 million in funding went to support 2% of children aged 0 to 6 and 4% of centres. That is unacceptable, and COVID made that inequity worse. We are offering a survey to every single parent, childcare worker, and childcare centre operator, as well as the preschool operators across the province, to take part in online surveys, as well as the in-person consultations that are being led by my MLA colleague from Grand Prairie, and we are happy to hear the feedback from Albertans on this front.
The Honourable Member for Edmonton Whitemud with no preamble, please.
Thank you, Mr. Speaker. Well, given that all Albertans would like to hear the results of those consultations, and given that only 30% of centres have reopened and many don't even know if they can reopen or if they will survive 3 months waiting for more financial supports from this government, and given that to move ahead with economic recovery for all Albertans, particularly women, the government will need to ensure the availability of accessible and affordable childcare. To the minister, do you have a long-term strategic plan for childcare in Alberta, and if so, what is it?
The Honourable, the Minister of Children's Services.
Thank you very much, Mr. Speaker. As I've said before, we are absolutely committed to an equitable approach to safe, high-quality, accessible, and affordable child care for those who need it in Alberta. But let me be clear, Mr. Speaker, that what we won't do is listen to the members opposite. They had grand plans to fund a $1 billion child care program and no way to fund it. They forget, Mr. Speaker, that they were in government. They have a record, racking debt, picking winners and losers, supporting 2% of parents, 4% of centres, ignoring small business and preschools altogether. together, Mr. Speaker, that we won't do.
The honourable member.
Thank you, Mr. Speaker. Given that the question is what the minister's plan is, and it's clear that she does not have one, given that what childcare operators have been asking for in the 6 town halls with the minister is adequate and substantial financial support, and what they've received so far, $11 million, not $17 million, is only a Band-Aid on a crisis, and given that the minister has the money in her budget and is also receiving federal income supports for childcare, and given every reputable economist in this country is calling for childcare to be a key component of economic recovery, will the minister commit to immediate and real support to the sector now, minister, not after the system collapses?
The honourable minister.
Mr. Speaker, I absolutely agree with the member opposite that childcare is hugely important to getting Alberta parents back to work. We are doing what we asked for. Alberta childcare and preschool operators on those town halls asked us to reinvest $18 million in funding, and Mr. Speaker, we're doing that. They asked us to move forward with this consultation. I know the member opposite doesn't appreciate that, but it's because we were asked not only by our sector stakeholders, but also by operators on a town hall to move forward now. We've got to get rid of red tape. We've got to make sure that this sector is viable, and we're going to continue working with the federal government on making sure childcare is available for Alberta parents.
Order. The honourable member for Calgary-Glenmore is the only one on the call.
Mr. Speaker, with half of Calgary's small and medium business on the brink of collapse, and with so many Calgarians out of work and unable to make rent, the Calgary City Council decided to continue their reckless fiscal management. Downtown and Beltline apartment buildings could face a tax hike of up to 40%. And make no mistake, Mr. Speaker, at the earliest possible opportunity, that increase is going to be flowed right directly to renters. To the Minister of Municipal Affairs, what is the provincial government going to do to rein in a reckless Calgary City Council?
The Honourable the Minister of Municipal Affairs.
Thank you, Mr. Speaker, and to the member for that important question. Mr. Speaker, I have been crystal clear with Calgary City Council and councils across our province that we cannot tax our way out of a recession. Mr. Speaker, despite this pandemic, the province is managing to keep taxes low, deliver essential services, and streamline our operations. Our expectation is that our municipalities will do the same, and we're starting to see positive signs on this front.
The honourable member for Calgary-Glenmore.
Mr. Speaker, given that the work of the provincial government to decrease taxes and that a tax hike is especially harmful while Albertans are financially down because of low oil prices and the pandemic, and given that the City of Calgary is undermining this with a massive tax hike, which will also result in increased rents, and given that our government reduced education property taxes, but Calgary residents have not seen this flow through, to the Minister of Municipal Affairs, will the government step in to stop the City of Calgary's massive tax hike?
Minister of Municipal Affairs.
Thank you, Mr. Speaker. Mr. Speaker, our government has set a clear expectation for how we support our people at this difficult time. Low taxes isn't just a conservative value, it is an Alberta value. Politicians who increase taxes on Albertans at difficult times would need to answer to those same Albertans in elections. We must always remember, Mr. Speaker, that there is only one taxpayer, and ultimately that taxpayer is the boss.
The honourable member.
Thank you, Mr. Speaker. Given that the City of Calgary has one of the most bloated government budgets in the country, which includes not one, but 2 pensions for the mayor, and given that there is no indication they are seriously attempting to reduce spending whatsoever, to the Minister of Municipal Affairs, what will the government do to impose fiscal transparency at Calgary City Hall?
The Honourable the Minister.
Thank you, Mr. Speaker. Mr. Speaker, among other things, we have committed to introducing a municipal measurement index, which will empower voters to compare things like tax rate with similar jurisdictions. Mr. Speaker, the municipal measurement index will increase transparency for all Albertans, regardless of the communities where they live. This is something we promised to deliver, Mr. Speaker, and it's another promise that we are going to keep. I look forward to making this announcement as soon as possible.
The member for Edmonton Meadows has the call.
Thank you, Mr. Speaker. I was pleased to see a news release sent at 10:03 a.m. today from the Minister of Culture announcing Alberta Spotlight, which will provide online concerts showcasing Alberta talent. This is a good first and logical step. We should know, since we did it last week, the Leader of the Opposition and our culture critic hosted a showcase with local artists. This announcement is a good first step, but to the Minister of Culture, what took you so long?
The Honourable, the Minister of Culture, Multiculturalism and the Status of Women.
Well, thank you for the first half of that question. It's actually, like most things, it takes a while to be able to meet and consult with all of these different organizations. As the member knows, there isn't just one type of musician, artist, or others in these provinces. In fact, they are some of the largest entrepreneurial groups that we have in this province, which means that there are several different conversations that have to understand how best to support them. This is just one of those initiatives.
The Honourable Member for Edmonton Meadows.
Thank you, Mr. Speaker. Given that a few weeks ago our caucus made multiple calls to support the arts industry based on countless conversations with artists, given the Alberta Spotlight plan focuses on those in the music industry, I hope the Minister has planned to support all artists. Given the Minister is clearly finally starting to listen to artists and to the opposition, will she now commit to refunding $3 million that have been cut to the Alberta Foundation of Arts and expand what artists can do with funding during the pandemic?
The Honourable Minister of Culture, Multiculturalism and the Status of Women.
Mr. Speaker, the budget that was released for budget 2020 is the budget that we are following through with, and I know the member knows this as well, but I will reiterate this yet again. The AFA is independent of the government of Alberta. The dollars that they flow to the organizations and groups that are supported by the AFA are done by the AFA independent of the government. I can say it 100 more times, happy to do so.
Member.
Thank you, Mr. Speaker. Given the arts industry generates over $5 billion to our economy and employs nearly 60,000 people, and given that when we first called for an artist on the Economic Recovery Panel, the Premier's office laughed at us, mocked the livelihood of arts and the contribution to the province. Then the artists laughed at the UCP lack of knowledge and awareness of the economic value of art. And given the UCP has claimed to be looking at ways to diversify the economy, will the Minister commit to putting an artist, not a representative for artists, on the recovery panel?
The Honourable the Minister of Culture, Multiculturalism and the Status of Women.
And it's another day, Mr. Speaker, where the facts are being yet misrepresented again. Peter Kiss is an absolute massive advocate for the arts and also works in the business sector. If the member looks at how the arts and the business sectors work together, they are intertwined and absolutely necessary for both to work together. It's absolutely imperative that these organizations are working together because the arts are actually supported by oil and gas, agriculture, and all of the other industries that government spent 4 years destroying.
The Honourable Member for Lethbridge West.
A couple of weeks ago, the Lethbridge School Division released a preliminary budget. Support staff positions are being reduced by almost 41 positions, of which 31 are educational assistant positions lost. The Lethbridge Board says these losses are due to funding cuts from the province. Government says there aren't any cuts. So can the minister explain why Lethbridge EAs are getting pink slips if there are no cuts? Or is the minister's real agenda to saddle young families with even more school fees to pay for these services, on top of the fact that the government has jacked our income tax, property tax, bus fees and car insurance?
The Honourable the Minister of Education.
Mr. Speaker, again, misrepresentation. Every school division in this province in the new 2020-21 school budget will see an increase in their funding. School budget, the school boards are in charge of their budgets and they make the decisions for their local communities.
The Honourable Member for Lethbridge West.
Well, thank you. Given that the Lethbridge School Division blamed the loss of 31 EAs directly on reductions to program unit funding, which the government says isn't being cut, that's weird, is this minister's real plan to add to their UCP hikes to our income tax, property tax, school fees, busing fees and car insurance by forcing parents to pay privately for support for their children with complex needs?
The Honourable the Minister of Education.
Mr. Speaker, the program unit funding, as I've said many times over, remains a vital part of our new funding model, and kindergarten students continue to receive support under the new Specialized Learning Supports Grant. We continue to recognize the importance of early intervention, and Alberta continues to have the earliest intervention program for children in Canada at 2 years, 8 months. I can't be any clearer.
Order. Order. There's only one person shouting in this chamber. The Honourable Member for Lethbridge West.
Given one Lethbridge mom said, quote, taking puff away from students is robbing them of potential we don't know they have yet. And another Lethbridge mom said, without the proper support, my son wouldn't be thriving, he would be shriveling. Why is this education minister making life so difficult for parents, particularly families with kids with complex needs? Isn't life hard enough with the tax and fee hikes? When will the UCP get tired of having their hand in our pockets and making life harder for parents and families?
The Honourable the Minister of Education.
Mr. Speaker, I will continue to reiterate the fact that eligibility for PUF has not changed, and the funding cap remains at $25,000 per student. Students with severe learning delays will continue to receive funding at the same level as they do today, and we've also matched speech and language funding to actual need, ensuring that students continue to receive the supports they require to succeed. We are committed to early intervention for our most vulnerable students.
The Honourable Member for Drumheller-Stettler has the call.
Thank you, Mr. Speaker. As the Minister of Finance has previously mentioned in this House, January and February were proof that our economic strategy was working. However, the COVID-19 crisis has drastically altered Alberta's reality by increasing the unemployment rate to 15.5% and forcing many businesses to close. We know this will be compounded by the end of the federal CERB assistance come August. To the Minister of Finance, can you please inform this House how our government will get Alberta's economy back on track and how we will get Albertans back to work?
The Honourable the Minister of Finance, the President of Treasury Board.
Well, thank you, Mr. Speaker, and thank you to the member for the question. The member was quite right. In the first 2 months of 2020, early economic indicators really demonstrated that our economy was in fact growing. Drilling rigs, the number of drilling rigs had increased. Building permits were up. Goods exports were up. Retail sales were up, all up year over year. Mr. Speaker, our policies were working. Our economy was improving, and investment was returning to Alberta. As we recover from the COVID economic crisis, we'll continue to create the most competitive business environment in the country.
The Honourable Member for Drumheller-Stettler.
Thank you, Mr. Speaker. Given that in April, the Bank of Canada reported that it needed to take more extensive measures to handle the sudden and deep contraction in the economy through increased lending to financial institutions and governments, and given that due to the liquidity concerns, the oil price downturn, and lack of international economic activity, there is now concern for the housing market and housing prices. To the Minister of Finance, how does the potential lack of liquidity and the risk of a housing downturn affect Alberta's economic recovery?
The Minister of Finance.
Well, thank you, Mr. Speaker. When the economic crisis hit, Mr. Speaker, the first thing we heard from businesses was the need for liquidity, the need for additional capital. Mr. Speaker, that's why we moved quickly to provide liquidity relief for individuals and businesses through the corporate income tax deferral, the Workers' Compensation Board premium deferrals, and paying half and medium-sized businesses WCB premiums, freezing and deferring education property taxes, and ensuring the ATB offered flexibility with their loan deferrals and payments, Mr. Speaker.
The Honourable Member.
Thank you, Mr. Speaker. During the Premier's address to the province in April, he said, "The end of the pandemic will not be the end of the economic downturn, the likes of which we have not seen since the 1930s. Given the circumstances and challenges facing Alberta as we begin to recover from the pandemic, and given the conversations that I've had with Albertans, it is clear many don't realize just how bad this could get. To the Minister of Finance, can you please inform this House on the unique challenges that Alberta is facing and how our government plans to overcome them?"
The Minister.
Well, thank you, Mr. Speaker, and to the member for the question. COVID-19 changed the world in a matter of weeks. The global economy contracted, and Alberta was not spared. Demand for our exports diminished, stock markets crashed, and Alberta businesses suffered, Mr. Speaker. Mr. Speaker, we've introduced a number and series of programs in response to the crisis, and we'll be releasing an economic plan in the coming weeks that will guide our recovery. But, Mr. Speaker, I'm confident that Alberta has a bright and hopeful future because of the resilient, resourceful character of its people.
The Honourable Member for Calgary-Falconridge has risen with a question.
Thank you, Mr. Speaker. The government announced a plan on April 9th designed to get Alberta and its citizens back to work. The government allocated nearly $2 billion for various projects, including improving the highways in southern Alberta. Can the Minister of Transportation please tell the House how the government plans to improve the southern Alberta highways with this funding?
The Honourable, the Minister of Transportation.
Well, thank you, Mr. Speaker. The honourable member is correct. Our government did set aside $2 billion as part of our response to COVID-19 to resurface roads, repair bridges and other ministries, restore schools, also fill potholes to get thousands of Albertans back to work quickly and safely. By focusing on maintenance and renewal projects, we're making sure that we get work done now that needs doing, while making sure the important infrastructure is there for years and decades to come for the economic recovery.
The Honourable Member for Calgary-Falconridge.
Thank you, Minister, and thank you, Mr. Speaker. Given that the pandemic has severely impacted the Alberta economy, and given, Mr. Speaker, that much of our provincial workforce is just now starting to return to their jobs or looking for new employment, what is the government's plan to ensure that these Albertans can use their skills and expertise in these new projects to get themselves working again?
The Minister of Transportation.
Well, thank you, Mr. Speaker. Well, first of all, the infrastructure investments we're making are focused on projects that can get started quickly because Albertans need the jobs today. We're fixing our highways, keeping companies operating on those highways, and most importantly, keeping Albertans working. But in longer term, Mr. Speaker, well, we're creating over 3,000 direct and indirect jobs now through maintenance and renewal projects on highways, bridges, and potholes. What we're really doing is building a base for the Alberta's recovery to come, not only now but decades to come, because our children and grandchildren will pay some of the money back that we're spending, and they need to benefit as well.
The Honourable Member.
Thank you, Minister, and thank you, Mr. Speaker. Given that many of these projects are occurring in short time and moving as quickly as possible, and given that highways will still need to be used during our relaunch, and given that many of these highways are vital connections between our communities, what is the government doing to make sure that delays for Albertans getting back to work in other industries that rely on these highway networks are kept to a minimum?
The Minister.
Speaker, the honourable member is right. When you do construction, there's no doubt there's a certain level of inconvenience. And as Albertans are traveling the roads this summer, I'm sure that they will many times have to slow down. And please do slow down on those construction zones, because you're keeping your fellow Albertans safe as well as yourself. But Mr. Speaker, we try to plan around that to make to do this in an organized way. And as Alberta gets back to work, we want to make sure that they're safe, that the driving conditions during that time are good, that they maximize the recovery of our economy, because, Mr. Speaker, right now we need to get as much right as we can, because Albertans are hurting and we need to help.
Honourable members, in 30 seconds or less, we will return to member statements. The Honourable, the member for Lesser Slave Lake has a statement to make.
Mr. Speaker, throughout the past several weeks, COVID-19 pandemic has been the forefront of most Albertans' minds, and rightly so. However, there has been one other topic in my constituency of Lesser Slave Lake that has dominated discussions: roads. Not a day goes by where I don't hear from constituents who are concerned about the road conditions, most notably Highway 749, 2, and Highway 88 in the Slave Lake area. People are concerned for the safety of their families and concerned about the mounting costs from damages to their vehicles due to potholes and the overall condition of the roads. Albertans in northern regions spend vast amount of time on the road, taking their kids to school, picking up groceries, going to work, or even filling up a tank of gas. Trips that take mere minutes in urban areas can take hours for people in Lesser Slave Lake. Though there is always more that needs to be done, I was extremely pleased to hear the announcement last month from the Ministry of Transportation about the road maintenance projects throughout Alberta, but particularly in Lesser Slave Lake. These maintenance projects are the good news stories that people in Lesser Slave Lake and all of Alberta need to hear right now. This investment into Alberta's transportation infrastructure not only creates jobs and helps stimulate the economy, it shows Albertans that despite being caught in the middle of a global pandemic, our government is listening to the everyday concerns of Albertans and is committed to keeping our campaign promise of getting people back to work and focusing on infrastructure projects that are key to the economic growth and stability of our province. Mr. Speaker, on behalf of the constituents of Lesser-Slave Lake, I would like to thank the Minister for his commitment to keeping Alberta drivers safe, and I'm looking forward to getting the shovels in the ground. Thank you, Mr. Speaker.
The honourable member for Fort Saskatchewan, Vegreville.
Thank you, Mr. Speaker. The coronavirus outbreak has brought so much change across the world, including here in Alberta. It has impacted our health, economy, and families, including our animals. Through it all, there have been many unsung heroes that have continued to deliver services in new adaptive ways that have ensured the safety of workers, owners, and our animals. I want to recognize the work of our veterinary medical professionals who are responsible for maintaining the health and welfare of animals and the security of our food supply. The veterinary medical profession has been a steadfast front line for our animals and their owners. My constituency of Fort Saskatchewan-Vegreville is the backbone of Alberta's agricultural sector and home to thousands of animals, both livestock and companion animals. The pandemic has produced an uptick in animal ownership. Veterinary clinics have been adapting to the current environment by using telemedicine and curbside service to ensure public health protocols are enforced while keeping our animals healthy. Over 3,800 Alberta veterinary professionals operating in 550 practices are facing significant shortages. Yet they remain diligent working in our communities across this province throughout the pandemic. These professionals are providing critical service delivery to our food animal, mixed animal, equine, companion animal, educational, zoos, and wildlife sectors. Veterinary medicine has been a vital partner to Albertans in the good times, but it is in the times of emergency we recognize how critical the profession is to public health, safety, and economic sustainability in our province. I want to recognize all the members of the Alberta Veterinary Medical Association for their adaptations and ongoing commitment to being our frontline workers for animal health. You are essential to our local producers, local economies, and the future economic recovery and growth in Alberta. Thank you.
The honourable member for Airdrie Cochrane is rising with a statement.
Thank you, Mr. Speaker. Albertans feel unease over the security of our communication systems. The move to 5G networks has intelligence agencies concerned about national security risks from unreliable vendors. The U.S. is warning members of the Five Eyes Intelligence Alliance against the use of Huawei products in their network infrastructure. They cite China as posing significant risk to the exploitation of military, government, and corporate secrets. Five Eye members, the US, Australia, New Zealand, and the UK have all said no to Huawei. The only country yet to decide is, of course, under the Liberals, Canada. As usual, the Trudeau government is dragging its feet when it comes to protecting Canadians, as we saw with their delayed response to the pandemic. Proceeding with Huawei not only risks data integrity, but also the loss of access to classified Five Eye intelligence. China has thrived, in part, on reverse engineering intellectual property, providing them an unfair advantage. In Hong Kong, they interfere with democracy and seek to unlawfully arrest and extradite those who object to the communist regime. With this history, it's surprising that China is a leading voice at the World Trade Organization and the Human Rights Council. That said, Huawei assures us their 5G network will not be used for the purpose of espionage. Yet, charges against Huawei executives indicate accusations of racketeering, money laundering, and conspiracy to steal trade secrets. Fortunately, last week, industry players Bell, TELUS, and Rogers, sharing these concerns, decided against the use of Huawei products. Mr. Speaker, COVID-19 shed a light on the importance of protecting national interests. Canada needs to follow industry's lead and say no to dictatorial regimes, stay in the Five Eye Alliance, and keep our data secure. Thank you.
Presenting reports by standing in special committees. Presenting petitions. Notices of motions. Introduction of bills. Tabling returns and reports.
The honourable member for Calgary Mountain View is a tabling.
Thank you very much, Mr. Speaker. On behalf of my honourable colleague for Edmonton, Glenora, I rise to table 5 copies of the letter she referenced in her question today from 2 brothers, one of whom is a disabled Albertan, asking Premier Kenney not to attend their graduation.
Is there other tablings? And just a reminder to members, once your tablings has been completed, if you'll place it in the tabling boxes on the tabling tables, that would be excellent. The honourable member for St. Albert.
Thank you, Mr. Speaker. I have a tabling on behalf of the member for Edmonton Glenora. A post by the Premier dated January 1st, 2015. Today, the political party per vote subsidy, which costs taxpayers $25 million a year, is history. Now party contributions are voluntary, not mandatory.
Are there other tablings? The honourable member for Calgary Fish Creek, followed by the member for Edmonton Rutherford.
Thank you, Mr. Speaker. I rise today to table requisite copies of 4 different letters of support for Bill 201, Strategic Aviation Advisory Council Act. First one is from Delphi Aeronautics, Mr. Alan Tay, President, who strongly supports the bill. Second is for the Alberta Provincial Committee of the Air Cadets, from their chairperson, Mr. Barraclough, who also strongly supports the bill in support of the work that they are doing. One from Jerry Clammer, who is a member of the Alberta Aviation Council, in support of Bill 201. And last but certainly not least, from WAVE Business Beyond Borders, founder Kimberly Van Vliet and President Brad Robson, technology and aeronautics and aerospace-based company, who also strongly support the bill. Thank you, Mr. Speaker.
Honourable member for Edmonton Rutherford.
Thank you, Mr. Speaker. I stand to submit documents, the requisite number of documents, of a tweet by the Premier dated May 22nd, 2016, in which he says, "I fought for years to cut taxpayer funding of political parties. Delighted we got it done." Irony given their present behavior. Thank you.
Are there other tablings? Seeing none, the clerk.
Tablings to the clerk.
Honourable members, orders of the day, orders du jour.
Under Government Bills for second reading, Bill 17, Mental Health Amendment Act 2020. Honourable Mr. Shandro.
Minister of Health.
Well, thank you, Mr. Speaker. And I rise today to move second reading of Bill 17, the Mental Health Amendment Act. Mr. Speaker, it's a privilege to rise and speak about this important piece of legislation. It's my hope that Bill 17 will gain the support of all members of the Assembly. The Mental Health Act allows for people with serious mental health disorders to be involuntarily detained in a facility for treatment or to receive mandatory treatment in the community. Detaining someone under this legislation is intended to be a last resort to help treat those with serious mental disorders who are likely to cause harm to themselves or others. Now, Bill 17, the Mental Health Amendment Act, would bring in changes to strengthen the existing protections of patients' rights. These changes are necessary to address a 2019 decision of the Court of Queen's Bench, which found sections of the Mental Health Act unconstitutional or incomplete. Mr. Speaker, it's protecting patients' rights, which is our government's first priority. As we engage in a significant expansion of mental health and addiction services in this province, we must take all necessary steps to strengthen the protection of these rights. To do this, the amendments in Bill 17 would define and clarify several terms, including treatment, secure location, and qualified health professional. Now, defining the term treatment for the first time is important because it will clarify when a person can be detained. The Act will now require that a person be able to benefit from a treatment in order to be detained. Now, defining the term qualified health professional is important because for the first time under the Act, nurse practitioners will be able to assess, be able to examine, and be able to supervise patients. But to ensure the highest level of patient care, some measures taken under the Act will still require physician oversight. Defining secure locations, well, this opens the door in the future to increasing the number of places to which law enforcement can take people to be examined, to be assessed. This would reduce travel and wait times for patients, Mr. Speaker. And finally, further defining mental disorder, this will clarify who the legislation is intended to support. For example, someone with a brain injury could not be detained under the Act. However, if the patient has both a brain injury and a mental health disorder, then the patient would still benefit from mental health care and could be detained. The Mental Health Amendment Act would also permit health professionals to provide information to a close family member of a detained individual. Often the job of caring for a person with a mental disorder falls to family members. These family members shouldn't be kept in the dark about their loved one's mental health in such a critical time. Hospitals and healthcare facilities would also be required to provide more information directly to the person being detained. This includes free, timely access to their medical records, information about and access to free legal counsel if necessary, and information about the mental health patient advocate. Changes to the role of the mental health patient advocate mean that the advocate will contact each person or each patient who wants their help. The advocate will also work more closely with AHS to make sure the patients and their family get information that they need. The Act will also better protect long-term patients by ensuring that they receive treatment plans so that they can understand the nature of the care that they can expect to receive. And the forms that are used for their detention will be reviewed to ensure patients and their families receive complete information. Mr. Speaker, providing this information and support should be a given, and we are proud to be codifying it as a legal requirement. To this end, government will now have the ability to require that Alberta Health Services report on matters that fall under the Act. And we're giving the mental health review panels more power to tailor solutions to help long-term patients reintegrate into the community. We're also modernizing our legislation. Proposed amendments would allow for some examinations and assessments to be conducted using video conferencing technology where appropriate. Frankly, this use of technology is long overdue. A person can't be detained for longer than 24 hours unless they have been examined in 2 separate situations and found to meet admission criteria by 2 separate health professionals. Using video conferencing would help ensure that these examinations take place in a more timely manner. It may also mean that a person won't need to be transported, in some case for hours, to get to a facility to be assessed in person, just to find out that they don't actually meet the criteria and to be released hours from where they were picked up. And as you can see, these proposed amendments are not only necessary to address the 2019 court decision, they're also necessary to safeguard the rights of patients and make our mental health system more responsive and accessible. As a result of these changes, patient care will be more timely and patient-focused, and families will be able to support and care for their loved ones in a more significant way. I encourage all members of the Legislative Assembly to support second reading of Bill 17, and I look forward to debating this bill with my honourable colleagues in the future. Mr. Speaker, I move second reading of Bill 17, the Mental Health Amendment Act. Thank you.
Thank you, Honourable Minister. We are debating second reading of Bill 17, Mental Health Amendment Act. Are there any honourable members wishing to join debate? I see the honourable member for Edmonton Whitemud has risen to join.
Thank you, Mr. Speaker. It's a pleasure to rise in second reading today of Bill 17, the Mental Health Amendment Act, and I thank the Minister for introducing this Act and for bringing this bill forward for discussion and debate in the House. I also appreciate the comments that the Minister providing an overview of the contents of the Act. It is well, it's not the biggest Act we've certainly had to, or bill that we've had to review this session. It is substantive because it does address so many different parts of our current mental health system, as well as responding, as the Minister noted, to a decision by the Alberta courts in JH versus Alberta Health Services, which was a July 2019 decision that I believe the Minister indicated portions of this Act are intended to respond to. So I'd like to take a moment first, Mr. Speaker, to simply state that we are happy to see legislation coming forward that will make changes and will consider and review portions of the Mental Health Act. Certainly, we know that there have been concerns with certain sections of the Act and how they've been applied, and I'm very proud to be part of the official opposition caucus, which has repeatedly put mental health issues and taking those concerns seriously at the forefront of the actions they took under government, and we continue to put it at the forefront of our work as opposition as well. Certainly, mental health is something that we for far too long was ignored by many jurisdictions across the continent, certainly not unique to Alberta, as the real health crisis that it is. And what I've actually taken some heart in during the troubling and challenging times of the pandemic has been to hear how much mental health was immediately identified at the forefront as something that we need to be alive to. And I can tell you, as somebody who grew up in the school system in this province, and I didn't hear mental health talked about, and now we're hearing right away when we're talking about how our children, for example, are experiencing and managing the stress of this time. At the forefront of those discussions are mental health. So we realize now we're putting it as part of the holistic health and well-being of everybody, including children, is mental health. And I do hope that we will see some concrete commitments from this government going forward on pieces about specifically children's mental health, particularly as they go back to school, and we need the resources in our systems to support students as they return to school. But back to the bill before us today, Mr. Speaker. I am happy to see legislation coming forward, but there are a number of questions arising from the bill that we hope to have a fulsome discussion and debate on within this Assembly as the bill goes forward. In particular, I want to note that there are a few questions that we have already, but specifically to the court case, which I believe the minister referred to it, but I suspect was probably a likely reason for the timing of this bill right now, because we know that the decision in JH versus Alberta Health Services was a decision that struck down portions of the current Mental Health Act and provided essentially the legislature, the Legislative Assembly, and the government to bring forward amendments to that Mental Health Act within a 12-month period of time. So that decision was issued, I believe, July 2019, and of course here we are, June 2019, with the process ahead of us of debate in this House. I imagine that is the reason why the timing of this bill, but there's questions about it that I have, particularly because the decision in JH versus AHS was quite specific about which sections of the current Mental Health Act were struck down and actually ruled to be of no force and effect. So in particular, I note that the Section 2, for example, of the current Mental Health Act, which sets out the requirements for an admission certificate. So this is when a person is admitted to a mental health facility or hospital for treatment, detained, really. And that provision was struck down, Section 2, by the court, and we do see amendments brought forward within Bill 17 that specifically address Section 2 of the current Mental Health Act. As well, the decision in JH versus AHS struck down, the court's decision struck down Section 8, subsection 1, and Section 8, subsection 3 of the Mental Health Act, which dealt with renewal certificates. However, when we look at what's being put forward in Bill 17, Section 8, subsection 1 of the Mental Health Act is amended by Bill 17. However, Section 8, subsection 3 is not amended by this bill. Neither are Sections 4, subsection 1 and 2, or Section 7, which deals with the effect of one admission certificate or the effect of two admission certificates. Neither of these sections, which were struck down by the court in its decision and are now will be of no force and effect as of July 2020, have been amended by Bill 17. Now, I simply raise this because if this bill is intended specifically to respond to that court decision, it raises some questions about, well, why were some of the sections that were struck down by the court not amended? Now, perhaps, and I hope that the minister will stand up and walk us through how those provisions are still reflected, or the intent of those provisions in the Mental Health Act, which were struck down by the court. Perhaps they've been incorporated in another way into the Mental Health Act by virtue of this bill. It's not immediately evident to myself, but I admit that this is a new piece of legislation for me, and it is a bit of, this is the work we do as legislators, as we do look at the existing bill, the existing act, the new bill, as well as the court decision, and see how all those pieces fit together. But that's immediately one of the questions that comes to mind, because seems to be, the timing of it in particular seems to be in response to that decision. And so that decision, of course, I just want to go back because for those who may be listening and watching, and I'm sure there's actually quite a few people who in the mental health work as practitioners or have a loved one or themselves experience mental health challenges who might have questions about this. They might want to know a little bit of background about that decision in JH versus AHS, and my apologies, I'm just finding that in my notes. So this was a decision that came out of an action in September 2014, where an individual who I believe had an existing brain injury was then detained by admission certificate at Calgary Foothills Medical Center for almost, I guess it was, I'm looking at it, it's probably about 8 months or 9 months. That decision to detain and the process that individual went through was the subject of this court hearing. So in its decision, the judge ruled, as I indicated, that there were a number of sections of the Mental Health Act that were unconstitutional. And therefore were struck down. But as I indicated, Bill 17 does not seem to reflect does not reflect amendments to all of the sections that were struck down. I also am aware, Mr. Speaker, that this ruling is currently under appeal and that a decision may be issued. I appreciate that with COVID-19, certainly certain decisions will be delayed, but I think it's anticipated that a ruling would be made sometime later this fall. So I don't know whether or not the minister can shed light on this about why perhaps some provisions in this act were not amended, if that was related to the fact that this ruling is under appeal. But it does raise some questions as to why. There were other provisions within the ruling of the judge in JH versus AHS where the judge indicated that there were some other provisions that weren't struck down, were not ruled unconstitutional, but certainly encouraged the government to review them. And those are specifically Section 38 and Section 41 of the Mental Health Act, which deal with review panels. Now, I do note that there does seem to be amendments made to those provisions, and there seems to be actually the addition in Bill 17 of a Section 38.1. So I imagine that that's meant to address that, but I think we need to have a fulsome discussion about what was the direction of the court and how these amendments meet those directions by the court. I also note, and I note that my colleague, the member from Edmonton Manning, will speak to this quite passionately because, of course, she's been working in the area of mental health long before she was actually an elected official. She's done a lot of work as a social worker, and she's very passionate about these issues. And she's noted that the court's decision in JH versus AHS actually also strongly recommends that there be some definition of harm be incorporated into the Mental Health Act, and we don't see that as part of Bill 17. So again, I'm hoping when we get into Committee of the Whole, perhaps, if of course I do not want to presume that this bill will pass second reading, of course we can't make those presumptions, but should it pass and we get into Committee of the Whole, I would like to hear from the Minister as to why certain directions from the Justice in that decision were followed and were incorporated directly into Bill 17, as well as why certain provisions weren't. So in addition to responding to that ruling, I note that the minister indicates that there's several other intentions behind the amendments here in Bill 17. For example, expanding those who would be able to assess, examine, and supervise patients receiving community treatment. I know, for example, that I believe there's a broader definition of qualified healthcare professional incorporated into in Bill 17, and I would like to certainly hear from some of those expanded category of medical health or healthcare professionals to hear about what their view is about their role in these kinds of assessments and whether they are in support of having this broader authority to do that. The minister noted a number of times that nurse practitioners, and I noted that as well, as being one category of healthcare professional that is now going to have this broader capacity to be involved in assessing and examining patients. But I note that the definition that's actually set out in Bill 17, the new definition, and I believe the minister referenced it, with respect to who a qualified healthcare professional is quite broader than just nurse practitioners. At least that's how I read it. Yes, thank you. And my esteemed colleague from St. Albert is nodding, and that's she flagged that for me, and I appreciate that very much because it's true. It actually says a qualified health professional. This is, my apologies, Mr. Speaker, I'm reading from Bill 17, and this is section this is Section 2 of the bill, amending Section 1 of the Mental Health Act, and it defines a qualified health professional as a physician or nurse practitioner or a person who is registered under Section 33, Sub 1, Sub A of the Health Profession Act as a member of a health profession or of a category within a health profession. So that's actually quite a broad group of individuals. We know that there's quite a few practitioners in the healthcare world that are regulated. I recall actually taking a little bit of a look at Section 33, Sub 1, Sub A of the Healthcare Professions Act. Actually, when we were considering in this House, and as I am a member of the Private Members Bill Committee, when we were considering Private Members Bill 207, because that also provided broad authority to reject, in that case, the provision of healthcare services to certain individuals. And so I remember noting how broad that scope of professionals actually is. It actually included, I believe, social workers, if I was correct. And physiotherapists, occupational therapists, speech language pathologists. It's quite a broad category of individuals. Again, I believe these professions all play a significant role in our mental health care system and the supports for individuals. But whether or not they should be, I guess, within this new definition is a question that I have. I'm not saying yes or no. I guess I'm saying this is a significant change. It's much broader. It's not just nurse practitioners, and therefore I would like to hear from those colleges and those professions to see about their role and what they view about this. I don't know, and perhaps the minister will shed some light on whether or not he's already done that consultation with those professions to see whether or not they believe that they should have an expanded role in terms of issuance of admission certificates and being involved in detentions of individuals with mental health conditions. So that's a very important question that I have, along with, as I mentioned earlier, why certain provisions and certain sections within the Mental Health Act were not amended as suggested and, in fact, required by the courts. I understand there was a sunshine clause that was originally within the Mental Health Act. Again, on first reading, it appears that it's no longer there. So I would like to hear some discussion about that. And, you know, I do appreciate that the minister talked about greater access to information for those people who support those with mental health conditions, because we know that within our current system, those people who do have significant mental health conditions do require support. And we need to making sure that there is, I guess, the appropriate information to the appropriate people. But I'd want to make sure there are safeguards whenever we're talking about disclosing really deeply personal health information, especially around mental health. We want to be very careful, of course, as to how that's categorized and who has access to that. But I think, in general, we need to make sure that the people who are there to support individuals with the mental health conditions do get the support they need. And if that requires greater information disclosure, that's important. I do note that I have questions, I suppose I should say, that the bill revises admission criteria, so only people whose disorder could be improved by treatment can be detained. So I understand, for example, patients with permanent brain damage, such as those with fetal alcohol syndrome disorder or stroke, could no longer be detained unless they have, in addition to that, a mental disorder such as, for example, schizophrenia or bipolar disorder. I just have questions about that. I need to understand that a little bit more in terms of, I believe that's a response to the court case, but I know a number of my colleagues work very closely with stakeholders who work with individuals with brain injuries and would probably have some feedback on that, and I'd like to hear from that. And I'd like the opportunity for stakeholders to have the time to review this bill as well and provide their input. You know, I note, of course, that there is provisions in here that are intended to, I guess, reduce red tape, more time for physicians and patients to coordinate examinations, no longer requiring forms to move patients between two Alberta Health Services facilities, and authorizing the minister to designate and classify facilities so the health system can be more responsive. That sounds good, but those I would love, again, to hear a little bit more from the minister about what the need was that was addressing. Overall, Mr. Speaker, I think I've raised the questions already. I think we do want to see a stronger mental health act, one that is more responsive to conditions. We don't want people who have mental health conditions to be detained improperly, unnecessarily, and of course unconstitutionally. I do think it's very important that we continue to respect those rights of individuals with mental health conditions and make sure that they are treated with dignity and respect in our system. And we want to provide the best level of care we can. I just simply have questions as to why certain things were not incorporated in this bill that seem to have been required by the courts, and I look forward to a fulsome discussion as well as the opportunity to hear from, for our caucus members in particular, to hear from some stakeholders with respect to their response to this bill. So thank you, Mr. Speaker. I appreciate the opportunity to speak.
Thank you, Honourable Member. I see unfortunately there is not a 29-2A, so I expect that perhaps you might catch my eye after the next speaker. Are there any other members looking to join debate? I see the Honourable Member for St. Albert has risen.
Thank you, Mr. Speaker. It's my pleasure to rise and speak to Bill 17, Mental Health Amendment Act 2020. And like my colleague, I think that I do have a number of questions. A number of questions that I could not answer simply by going through the legislation and then looking through the other pieces that were noted in this Amendment Act. But hopefully the minister is keeping notes and is keeping track of the questions that we are asking. I think that an important piece of legislation like this that really does impact the life and death of Albertans, it is essential that we have the information so that we can vote accordingly and decide whether or not we support this piece of legislation. So I'm just going to add to my colleagues' questions. I do have a number of questions. And first of all, my first question is really, I would really like to know, I am going to give the government the benefit of the doubt and assume that there was a consultation that was done before this Amendment Act was put together. And so I would love to hear from the government who precisely the consultation was with. And so certainly in the legislation, it talks a lot about the examples that are used are people with traumatic brain injury, people, whether they've sustained a stroke, or are schizophrenic, have a diagnosis of schizophrenia. So I would like to know specifically which organizations or which individuals were consulted, and if at all possible, if those organizations were given the opportunity to provide feedback on the changes, it would be quite helpful to see perhaps a summary of that information. I think it is one thing to have lawyers and legislators looking at legislation and putting together legislation. It is quite another to have professionals that are on the ground doing the work also provide that feedback. So that would be quite helpful. Again, I want to sort of echo what my colleague said about why there seemed to be a deliberate leaving out of the mention or definition of harm. And I think that that is incredibly important. And I certainly didn't have enough time to go through the 45-page document that was available. So it was JHV Alberta Health Services 2019. But certainly the document references many times the importance of understanding and defining harm in a multitude of settings. So that would be a question that I would like answered. Another question, why not put an updated clause with a statutory review? And again, going back to what my colleague mentioned earlier, on page 2 of the bill, it does note, sorry, I'm just going to put my glasses on. It does note that qualified health practitioner means a physician or nurse practitioner or a person who is registered under Section 33(1)A of the Health Professions Act as a member of the health profession or of a category within a health profession designated by the regulations for the purposes of all or part of this act. Now, perhaps I'm missing something, and hopefully the minister will be able to clarify this when he has an opportunity to speak. But that checking in the Health Professions Act, looking at this section, it doesn't give me a lot of clarity about what the intent of this piece. Go back to this. Sorry. So what we're hearing from the government is that if Bill 17 was passed and approved, that it would revise the admission criteria so only people whose disorder could be improved by treatment can be detained. And I believe the examples given were patients were with permanent brain injury, such as people with fetal alcohol syndrome, etc., stroke, could no longer be detained unless they have mental disorders such as schizophrenia, etc. It would be helpful to, I guess, because this is such a large category, and I think science and research has advanced so much, that would actually be really helpful to have the minister stand up and expand that definition and give us more examples of what precisely that entails or what that covers. I also am a little bit concerned a number of times, again, and I'm looking through the legislation, trying to find more specific information, and when it says that the disorder could be improved by treatment. And I think that is certainly subjective, and I think when you add to that the uncertainty around which health profession will be making some really significant decisions and treatment decisions, a better definition of this would be helpful. I'm certainly not asking for whatever assessment tool would be used or anything like that, but certainly a better definition or better description of what that means would be most helpful. So I want to move ahead a little bit to the portion that talks about the minister noted that this legislation would strengthen patient rights. So I would like to talk about that. So Bill 17 would, in theory, require hospitals and healthcare facilities to provide patients with free, timely access to a number of different things, which is important, obviously, just looking through this particular case that seems to have triggered these changes. There certainly were a lot of things that were missed. However, that this would give patients free, timely access to medical records, information about legal counsel, including access to free legal counsel if applicable. I think if you ever needed more proof that adequately funding things like legal aid are certainly important. To review forms in a timely way so that patients know why they are detained. Certainly that was not done. Again, doesn't seem to have been done in this particular case. And that, I'm going to skip over that one. And to provide a treatment plan to patients staying in hospital for 30 days or more, including criteria for release. These are all good things. Treatment plans are great things. Criteria for release are certainly vitally important if you are the people charged with making this decision. But I would like to add another piece, and I do think it relates to this. It's because it is one thing to meet criteria to release someone. It is quite another to discharge them without supports. And so again, what was interesting about this particular document, that was, it was JH versus Alberta Health Services. What was really interesting at the very beginning of the document, it described sort of, what happened. And one of the things, certainly after an accident and after treatment, the person describes a situation where they're released because of loss of income, loss of housing, resulted in homelessness. And I'm making a few assumptions here because I'm not quoting the document directly. But then obviously there were some substance abuse issues. And so I think it really underlines the importance of, if you are going to look at, if you are truly going to stand up in this place and say that this piece of legislation, the focus of this legislation is to support or to do as much as we can to support mental health patients in this case, that we have to talk about discharge planning and discharge supports, or the supports that people will need once they are discharged. Because far too often, and sadly I have seen this, is that far too often people are, and it's actually difficult sometimes to get people the help they need for them to be able to stay in a facility for longer than a few days. But if they are able to get the help that they need once they are discharged and meet whatever criteria, that is just another cycle, because the housing isn't there, the income isn't there. So let's say perhaps somebody on AISH. So they are on AISH benefits. Let's say they have a traumatic brain injury. They've qualified for AISH. Something else has come up. There is a mental health disorder, whatever that's mentioned in this piece of legislation. They're in hospital for, say, 90 days. Their AISH benefits are stopped. And so what that means is that they're no longer able to, let's say, continue paying for their rent of their apartment. They lose all kinds of things. So these are the things that need to be in place. So I think if we're going to talk about being very careful while people are in treatment, when the goal is you want them to be healthy enough to go into the community, you don't want them back, or you don't want them back quickly. So if that is the cycle, you want to delay that as much as possible. And the way that you do that is you invest in community supports. And sadly, there's not a lot of mention of that here. But it's also not been, this government has not done a great job, actually, on expanding and sustaining community supports that keep people out of hospital and other facilities. So in addition to, I'm also glad that the mental health patient advocate was not one of the pieces of legislation or roles that were rolled up into like the health advocate and the seniors advocate, then were assigned to party insider. I'm glad this is a separate person with expertise that is able to do this work. I am glad that all, as the minister said, that all patients who reach out and need this assistance will get it. That's good news. And to assure, sorry, I'm just going to skip ahead a little bit. One of the other changes, actually, that was interesting and good, and again, I look forward to hearing more about this, is that patients will be given 30 days as opposed to 14 to review the panel's decision, which is good, and allows a review panel to order a facility to issue a community treatment order instead of detaining a patient when doing so is more appropriate, and order additional independent psychiatric opinions if needed, which is also good. Now, I also read in this legislation one of the things, so a secure location or a treatment facility is anything that is done for therapeutic, preventative, or other health-related purpose, including the implementation of a treatment plan described. So, and I don't remember where the section is, but it seems to me that the minister was granted some extended ability to designate a facility. So if the member or if the minister could talk about that a little bit when he has the opportunity to do so. So that is about all of my comments for today. So I'm going to sit down and pass my time on to my colleague.
Thank you, Honourable Member. And just prior to 29.2a, I think I might have misheard something. Did you refer to a separate document as well during that?
Several, probably, yeah.
Could you table those at the appropriate time?
It's legislation.
Okay, perfect. Yeah, that's what I was trying to. 29.2a is available, and I see the Honourable Minister of Health has risen.
Thank you, Mr. Speaker. So quite a few questions. I'll try and get through as quickly as I can. Regarding Edmonton Whiteman's questions, I was asked about concrete commitments for mental health supports, especially specific to COVID and with children. I'd point out our April 15th announcement of $53 million. And, Mr. Speaker, if one were to add up all the additional mental health supports during COVID that every other province has announced, add them all up and multiply by 2, you get to about what we provided to Albertans and what we announced on April 15th. And included in that is $21.6 million which was to improve access to a number of supports that includes the Kids Help Phone. So there's quite a bit in there as well that was included to provide additional supports for children. Regarding the question of timing and whether it had something to do with the fact that this is under appeal right now and the decision of the court from 2019, the answer is no. Look, Mr. Speaker, I would have really liked to have tabled this back in early March, but COVID changed a lot of our legislative agenda, and here we are now in June, unfortunately, months later having to table this. And look, the fact that it's under appeal really doesn't change much for us at all as government, regardless of what the JH decision says. And yes, we did appeal it because it determined that the Act contravened the charter rights of patients. But at the same time, we generally agree with the principles that are included in this legislation, regardless of the decision of the Court of Appeal, the Court of Queen's Bench. There's a question about qualified health professional, and the honourable member is correct, but I think she missed reading the remainder of the section that's included in Bill 17. And so Bill 17 says, as she notes, that it means a physician or nurse practitioner or a member of a profession that is registered under the Health Professions Act. But it actually says, or a member or a person who is registered as a member of a health profession which is designated by the regulations. So it allows a government to have the flexibility at a future date. For example, if there's an expansion of scope for another health profession in the future, or we have a new health profession, say, for example, physician assistants at some point become a health profession. If a government determines that that health profession could assist in this act for an assessment, for example, then there could be the flexibility of making that designation under the regulations. I was also asked about the Court of Queen's Bench decision regarding Section 2, Section 4, Sub 1, and I think Sub 4, 4, Sub 2, and why those amendments weren't included in Bill 17. So Section 2 is amended in Bill 17. The reason that Section 4 Sub 1 and 4 Sub 2 are not included is because of the amendments that are made, though, to Section 2 that are included in this bill here, Mr. Speaker. And so specifically, and I think this goes also to the question that the member for St. Albert had regarding the definition of harm and why there wasn't a definition of harm that's included, because the court had determined that that was lacking in the bill. I point out that the changes that are made, though, to Section 2 in Section 3 of this bill, Mr. Speaker, is to the reference to harm to the person is removed. So the word harm does still exist in Section 2 should these amendments pass, but the reference to harm of oneself is removed. It's only harm to others. And the harm to self is replaced instead with to suffer negative effects, including substantial mental or physical deterioration, et cetera, et cetera. And so with those amendments, we believe that the concern with the lack of a definition of self-harm is no longer required because the reference to self-harm is no longer included. And as well, the concerns that the court had regarding 4 Sub 1 and 4 Sub 2 were addressed in that amendment. And with that, Mr. Speaker, I will allow my honourable friends opposite to continue with their debate.
29-2A is still available with about 25 seconds. Seeing none. Are there any honourable members wishing to join debate? I see the honourable member for Edmonton Meadows has risen.
Thank you, Mr. Speaker. It's my pleasure to rise in the House to have the opportunity to add some comments to the Bill 17, Mental Health Amendment Act. Let me say in the beginning that I haven't actually gone through the whole bill, but I'm happy to see that there have been some work being done and debate being conducted on the issue related to the mental health of the Albertans. So I will take, in coming days, hopefully today or in next few days, in the debate, I would like to really bring my inputs and proposals based on the experience and conversations with people in my riding and in my communities. And with my past experience dealing with some of the people, they have been through this sort of situation where they themselves or their family members have been, patients of the mental health. Listening to all those stories and watching the situation very closely and being part of, in some of the cases, to find the help for people, this is something always on top of my head, even not really knowing that there will be a time soon that when we will have the opportunity to discuss this matter in this House. I have actually mentioned the experience and the conversations and the view of my constituents on this many times when I was speaking to the other bills in this House. The problem of mental health is very, very not only serious, I will say very, very prevalent. It's not, first of all, only with the patient of mental health that if he has access to help or not, it takes long for the mental health patients to, first of all, admit or accept he has an illness, he has actually kind of problem that he needs help. And from that the first step or experience or situation, it's not only that delays the process of getting help for the mental health patients, but also the situation is very tricky and very difficult, very painful for the family of the mental health patients. And on top of that, it makes more painful when, in my experience, not even once, twice, in a number of cases in my community and around my family, when there was a case, the actual help was not available. It's regarding seniors. I can share the experience. It is some of those very bright young patients who lost their lives. And it's about the students in the school, the bright students. All of a sudden, everything started changing. And then the family's experience, I've been part of the conversation with schools and families, and the appropriate help was not available on time, I would say. And in many cases, the people, I exactly don't know what this bill is, how this bill is addressing these issues. That's why I said I will take the opportunity in the next few days to see and learn from it how this is going to address this very serious issue. The people, when they have some kind of intuitions, when the patient is there, kind of at certain level admit that he needs really a professional help, then we ended up landing at the spots or the places where actually those professionals are not really actually, how would I say, they are equipped or their job to deal with those unique situations or unique illnesses, and that also will have a huge negative impact of the health of mental health patient. Wanted to bring this into the discussion and would like to, in the sake of having this onto the record. In 2015, I just came across one event in my community in Southside, a man, very bright young man, patient of mental health patient, did not realize he was going through the problems, did not share his problems with anyone in his family, anyone within his friend circles, and lost his life. So his close friends and the students in University of Alberta came together, they were shocked, that was painful, and they decided they could not save the life of that young fellow, but let's see, come together. The other people will not get through the same situation. So they started the event that happens in September in Millwards, and that event has grown extensively to thousands and thousands of people attending that event to the awareness of mental health, where I see about nearly 400 or 500 tents of stakeholders, professionals, trying to bring the mental health awareness into the communities. So those are like some of my experiences directly related to the mental health patients, and also the other big issues that's very close and related to the mental health is the overdoses in our communities, in our province. It's a huge, and it is very costly for our community. Not being a public, figure, not being a public representative, not long ago, as just engaged, I would say, community member. I remember that I was running every single week and trying to keep up with the attending the events in funeral homes where our young men's constantly losing their lives due to the overdose issue, and a number of those cases are somewhere related to the people suffering from mental health, and if they were not, then their families really struggling to deal those with situation, really needed help to cope with and keep the situation under control, to help the person suffering with those kind of illnesses. Those are the experience. They were within my community, that happened on my street, and where unknowingly my own kids got involved in one case, tried to help the individual, but couldn't save the life of that individual. And I got a call from public. There's public outcry in a community. I got calls from lawyers. I got a call from other professionals. They wanted me to step up and do something about it. That's the other reason I was quite happy to see that in this House we have a piece of legislation on the mental health that we are discussing and we are debating, and I was so hopeful that it will help address some of those issues. And I have promised my community and all those professionals, they called me in and they have lots of information to share. They have already started some work on these kind of initiatives, and I will be sitting with them, and I will also be discussing. I would love to actually provide my feedback on that, and if we have any proposals. That is one of the concerns, not for the sake of just debate. When we discuss, I tried to raise the questions to Honorable Minister yesterday on Bill 20, when I was talking about gender equity, diversity, and inclusion. Some of very serious concerns when we see, compared to other jurisdictions, how they have achieved these goals. And I wonder if I have opportunity, I would really like to discuss these issues with other jurisdictions, how they come up with achieving some of these kind of goals. and I could bring the feedback to our house, I will be happy to do that. Those was like serious questions. The minister probably did not have the answers right then. You know, I honestly understand. I don't have answers to everything. That would probably be honest answer he provided. But this is something kind of very serious. When we do work in this house, when we debate the bills and the piece of legislations, behalf of our constituents, behalf of our people, Albertans, we want to keep in mind how we can address the actual issues our Albertans are facing. And I know the Minister of Health stood up in the House and provided some of the information, how he has involved some of the key stakeholders, but did not really give a name in the excuse me, Mr. Speaker. Didn't really have a list of names of those key stakeholders, but just give a benefit of doubt, he was providing some information on that. But how all those grassroots people, they are really actually victim of these issues. They are really being able to participate in this, then we can have some of the voices of direct experience, so we can learn from it, and those voices can also be reflected on the boards or in the discussions or in the panels, and where we can learn from it. That's some kind of idea I haven't seen, like, constantly have been missing on, I'm not saying this government's policy or direction is onto this. This is probably a very conventional way of doing our work in this province, but I think we need to change. We need to listen from the first-hand experiences, and we need to provide a place to these very ordinary people that I had actually chance but to listen as my constituents during the election on door knocking from mom that she lost her 19 years old young man to the mental health issue. This is something I know this bill is a result of even the court case. Where the judge has clearly recommended the government to take some of the changes in hand, and also stipulated a timeline with it that has to be done within the timeline. But I'm still glad that government actually is opening a debate on this, and we're discussing this issue in the House. And those are some of my comments on this bill. And as I said, I'll be going back and looking deep into the bill, and providing my further feedback on this, Mr. Speaker. And with these comments, I will move to adjourn the debate on this bill. Thank you, Mr. Speaker.
All right, thank you, Honourable Member. Having heard the motion by the Honourable Member for Edmonton Meadows to adjourn debate, does the Assembly agree with the motion? All those in favour, please say aye. Aye. Any opposed, please say no. That is carried.
Under Government Bills and Orders for second reading, Bill 16, Victims of Crime, Strengthening Public Safety Amendment Act 2020. Adjourn debate. The Honourable Mrs. Savage.
Are there any members looking to join debate? I see the Honourable Member for Calgary Mountain View has risen to debate.
Thank you, Mr. Speaker. And I rise to move an amendment on Bill 16. So I will wait for that to reach you.
Thank you, Honourable Member. If you would please read this into the record, and for everybody's benefit, this debate on this amendment will be referred to as RA1.
Thank you very much, Mr. Speaker. So I move that the Victims of Crime Strengthening Public Safety Amendment Act 2020 be amended by deleting all the words after that and substituting the following. Bill 16, Victims of Crime Strengthening Public Safety Amendment Act 2020, be not now read a second time because the Assembly is of the view that additional consultation with organizations providing support to victims of crime is required. And Mr. Speaker, I move this amendment because I believe that here in this province we have an incredibly strong model dealing with victims of crime. So for anyone unfamiliar with the present model, a huge majority of the work done in terms of supporting victims of crime, and including the work of turning up at 2 o'clock in the morning to deal with someone who has just had their life devastated, a lot of that work falls to volunteers. And that is, in a lot of ways, the strength of the model, because it is people who come forward and volunteer their time to help their neighbors, to support their neighbors. But those individuals are not necessarily trained professionals, and they don't need to be. But what they do need is to be trained to handle those things, because the things that these workers see when they volunteer with victims of crime are very, very troubling. I mean, that's true throughout the justice system. The thing you see as a police officer, the things that you see as a court clerk, the things that you see as any participant in the justice system are very, very troubling. But in this case, we're dealing with volunteers who are giving of their time to support their neighbors because they think it's important. And what they're asking for in return is that they be trained to fulfill those functions so that they're prepared to deal with the issues that are coming forward. I think that many people will be fortunate enough to have very limited interaction with the criminal justice system in their lives. So they may not be familiar with how difficult it can be to see those issues up close and to see the devastating impact that they have on the lives of those victims. But these people, the organizations that serve the victims, the volunteers that serve the victims, are very familiar with it. They're familiar with how the system works. They're familiar with what they need to do their work. And so I think that consultation with them is absolutely critical. Now, the minister has said many times that he went around and consulted on this issue. And certainly, I will give him credit where credit is due. He has done a very good job of consulting on the issue of rural crime. And that is work that needed to be done, so good for him. But I think we can't consult with a certain portion of the population on one specific issue and say that that's sufficient. No consultation was done with these organizations that serve victims. And they have absolutely important voices to bring to the table. There are also victims of other types of crime. There are support groups for the families of homicide victims, at least in both Edmonton and Calgary. To the best of my knowledge, they weren't consulted. There are specific support groups, and in fact a network of support groups dealing with victims of sexual assaults. They, to the best of my knowledge, were not consulted. There are specific people working in the area of domestic violence. They were not consulted. And there are police and community-based victims associations that work throughout the province that deal with all different types of crime, and they weren't consulted. And in fact, one of the things that has happened already is that the association which serves those police-based victim services units have lost their funding. And what that does is it impacts severely on the training that the members of the individual victim service units get. A lot of people will think of this in terms of their own experience, and that may be Calgary or Edmonton, but the truth is that in many rural communities throughout the province where there are victim service units who are often located in RCMP detachments doing a lot of that work, those units are very small. It's a very limited number of people. They run on a shoestring budget. We're talking, maybe a couple $100,000. So they have maybe the ability to have sort of one full-time staff person. Everyone else is volunteers. And so what that means is that they need support with training. And the fact that they're able to serve entire communities on a variety of issues in this way, I think is absolutely amazing. And the fact that they do it on so little money is amazing. And so I think that to say that these folks, who again are primarily volunteers stepping up to serve their neighbors, do not deserve to be consulted on a model change that impacts them directly is just wrong. So I think that consultation is absolutely critical. There are a number of areas of this bill that concern me and that I think might have been done differently were consultation to have taken places with these groups. So the history of this matter is that when the NDP was in government, there was a report from the Auditor General that dealt with the fact that there was a surplus in the Victims of Crime Fund. So one of the things we had to do was run some numbers to make sure that the fund was, because you have to hold a certain surplus in case suddenly money starts coming into the fund that can see everything through for a year. So we had to determine what that amount of money was. And then based on that, and based on what we expected the sort of increase over time to be on the fund, determine how to spend down the surplus in a slow and measured way so that those services would be sustainable. And some of the work we were asked to do is to determine what the needs of victims were and how best to meet them. And so we had rolled out a plan, some of which had been implemented and some of which hadn't. So there had been increases to the budgets of some VSU units, 5 of them, and they were the ones that had the greatest increase in demand without any increase in funding. But there was plans to increase the funding to many more because they need it desperately. There was also a plan to implement a model similar to, so in Calgary, we have a fantastic group called Homefront. They are one of the best, probably one of the best agencies in the country in terms of dealing with victims of domestic violence. And we wanted to extend that model to everyone in the province. And so there was supposed to be an agency that was set up to serve the rest of the province in a similar way. That agency is not going to go forward. The funding has been cut. So when the minister says that he's growing the pie, that may be true, the pie may be growing, but there are also people who are being cut off. And some of those people are the victims. Some of those people are those agencies I've mentioned, but some of those people are the victims themselves. So certainly we have heard that consultation will go on this matter, but I think my major concern is that it is already in legislation. A victim of crime is eligible only if, those are the words in the Act, only if. And then it lists some things, some of them having to do with the old Act before the Victims of Crime Act, 2 of them having to do with members of the class. There's a class action settlement whereby the government hadn't applied on behalf of children in care, and some of them having severe neurological damage. So what that means, only if you fall into these 4 things, is that no one else is eligible for benefits. So there are those benefits, there are death benefits, that is all that is left. And so it's all very well for the government to say, well, we're going to go out and consult on these things, but they'll have to come back to this House and change the legislation again in order to operationalize those things. Because presently, those people with whom they are consulting, or those people about whom they are consulting, are denied by the bill which is before this House. And so I think that that's a really good reason to go back and consult with these units. And in fact, we've heard from volunteers or members of these victim service units who attempted to attend the consultation that the minister was doing and who were denied access because they worked for victim service units. And I think that that is a big concern, because it suggests that the consultation was actually seeking a specific response. Now, that isn't to say that some of the moves the minister made haven't been necessary. Certainly, I applaud his move on drug treatment court. I think that that is an amazing move. What I don't think is that we should pay for that out of the pockets of victims of crime, because what we're saying is this money, which previously had to go to victims, will now instead go to treat those who potentially victimized them. Now, I'm not saying those people don't deserve treatment. They're absolutely worthy of treatment. They absolutely should get the help that they need. But to say to victims, you can't have money because we need to use it on the people who victimized you, I think is a bit harsh, and I actually don't think at all necessary. So that is the reason why I think we need to send this back for more conversations, because certainly I have dealt with this file. I had a plan for this file moving forward that involved spending more of this money on victims. But that being said, I'm not necessarily the expert. The experts are the people who have lived this and breathed this and worked this day in and day out. And so they should be consulted. And I think that that's a fair request. The things that the minister intends to do with the money, for the most part, are good. Certainly, Alert was running in a deficit position, spending down its surplus, so this investment was needed. That's true. But I think this division we're seeing, where you can only spend money on enforcement or you can spend money on support services, is a false distinction, because those two things go hand in hand. We know that the more supports we're able to provide to people, the less enforcement we require. And I don't think that we can say to a victim of crime, look, there just isn't enough for you. I mean, certainly it's fine for the minister to say, well, it's better to have more enforcement and then we won't have as many victims. But I don't think that's helpful to the people who are victims currently. And, you know, I've heard from people who have incredible stories of what they were able to do with the money they received. They were able to pay for counseling. They were able to cover the fact that they couldn't go into work. Some of these victims are victims of horrific crimes. Some of them have been beaten badly. Some of them have been sexually assaulted. And so it's very challenging to just move on with your life after that. Sometimes people need a little time to take off work to heal. Sometimes people need a little bit of counseling in order to get through that. And certainly victim services provide some of that support, but they definitely don't have the capacity to be a counseling service for every victim of crime sort of going forward into the future. And so that small amount of money that these victims received out of the Victims of Crime Fund went a long way for a lot of them. And I think that seeing that disappear is really, really sad. And I'm concerned about moves being made around the Victims of Crime Fund, because I actually think that this is one of the fundamental things that the justice system is going to have to grapple with. I have said this before, but in truth, victims victims of crime don't technically exist in the courtroom. So the people present are the Crown on behalf of we the people, and the defense or the accused and the judge. But the decisions that are made have massive impacts on victims of crime. And so, and from what I've heard over the last 5 years, those impacts are not generally positive. I've heard from some people who have had some horrific experiences, who have lost loved ones and felt that the treatment they received was wildly inadequate. And so I think this is not the time to take support away from those victims. I think the justice system needs to be grappling with how it is treating those victims and how it understands its impact on their lives. Because I have rarely heard from anyone who didn't find that the process, I've rarely heard from anyone who didn't find the process did not meet their expectations. And with that, I will close.
Thank you, Honourable Member. Are there any honourable members looking to join debate on Amendment RA1? I see the Honourable Member for Edmonton Ellerslie has risen.
Thank you very much.
292A is available. My apologies on this Amendment RA1. Are there any takers for 5 minutes of questions or comments? I see the Honourable Member for St. Albert has risen.
I would just offer some additional time to my colleague. I would like to hear a little bit more about her experiences hearing from the number of people I'm sure she's consulted with or she's spoken to about these important issues. Thank you.
Thank you. The Honourable Member for Calgary Mountain View has risen.
Thank you very much. So, yeah, I guess what I was saying is one of the reasons I think that these victim-serving organizations need to be consulted is because they deal with victims every day. And most people, in my experience, are, when they become the victim of a crime or when a loved one of theirs is a victim of a homicide or a loved one of theirs is a victim of any crime, they are very surprised by the process they meet when they enter the court system, and not usually pleasantly. You know, we talk often about Jordan because it's had a huge impact on our criminal justice system. And we talk about the delays and the impact that delays have on the lives of the accused person who is awaiting trial because their life is on hold. But that doesn't just impact the accused person. It often impacts a victim and the family of a victim while they wait for trial. And it is important, it is, in my view, critically important to protect the rights of those who are accused of a crime because they are accused and not convicted. And because we have convicted people wrongfully in the past. But it is also important to ensure that we are protecting victims. And I think everything in our system impacts them. And every time we talk about delay, we have to consider that that impacts them too. Often, I have spoken to people who have been unable to heal from the trauma they experienced, whether through what they experienced directly or whether through the loss of a loved one, because they feel like their life is stuck in this holding pattern while they await the outcome of the matter. They feel like they can't move on, they can't grieve, they can't heal because it just comes up over and over and over again with different appearances in court. And that's really, really hard on people. And so taking away funding that they may receive directly, taking away funding to support them, I think that's really challenging. And I think the intention behind the fund was to spend that money on victims. And I think we should. I think even if we increase the amount of the fund payable, I think we could still spend that on victims and still not be adequately meeting those needs yet. Now, I'm not saying those other things aren't important, What I'm saying is those are core government services that could have been paid for by not giving billions away to profitable corporations. And so we shouldn't create this sense of scarcity by giving money away to those who are already rich and then say, well, police and victims, you can fight it out, only one of you gets. I don't think that's appropriate at all, and I don't think, I think that if more consultation had been done, if appropriate consultation had been done with these organizations that serve these victims, that more of that might have been heard, that more of that that more of that would have come forward and been considered, because to someone who's lost a child, saying there will be more police who may prevent someone else from losing a child is not necessarily a lot of comfort. Not at a time when they're asking for support for themselves, not at a time when they feel like they're being dragged through a lengthy trial process that is difficult for them to understand without legal counsel. So, yeah, I think that the reason the legislature ought to delay the moving forward of this bill is for exactly that reason, so that we can hear from those voices which are often absent from consideration of the criminal justice system when it's done by lawyers. Not that I'm saying that lawyers aren't very important participants in the criminal justice system, just that we must speak to others as well.
Thank you, Honourable Member. Are there any Honourable Members wishing to join debate? The individual who caught my eye, order, is the Honourable Member for Edmonton Ellerslie.
Thank you very much, Mr. Speaker. Yeah. So I've gotten up a couple of times to speak on this bill, and then referring it to committee, and then now again on this particular amendment to also have continued consultation, but now specifically with nonprofit organizations, community organizations, and what I believe would be even especially important is police-based services that actually focus on nonprofit organizations with victims services units. And it's, from what I can tell, and again I reiterate that in this House I've asked the Minister repeatedly about several questions in regards to this piece of legislation, and I just want to highlight the fact that it seems to me that the Minister and the government clearly did not do enough consultation on this particular aspect of this proposed piece of legislation. And for that reason, I think that it would be pertinent for the government to actually refer this back and provide these nonprofit organizations this opportunity to really provide more feedback, since the Minister actually to some extent states that there has been consultation on this, but we don't know who the government actually consulted with, why they decided to consult with these particular groups, individuals, because we don't have any information on that, when it was actually done. We don't know what the government actually learned from any consultation that it did do, if any, at all, and whether the feedback is actually provided within this bill. Now, as was stated by the member from Calgary-Buffalo who actually put the amendment forward, it's not that we are against what the piece of legislation is actually attempting to do, because we understand the importance of what it is trying to do. But the problem that many of us have in the opposition is the fact that they're actually taking money out of the Victims of Crime Fund to actually do what it wants to do. And of course, we know I've talked at length about the actual benefits that the Victims of Crime Fund were providing through nonprofit organizations, community groups, and Indigenous and tribal communities, as well as municipalities and other nonprofit organizations, specifically with the Victim Services Unit. And these benefits were focused on individuals that experienced victims or violent crimes, I should say. Specifically, any physical damage, emotional harm, property damage, or any economic loss as a result of the crime. So I believe that it's absolutely important that we provide this opportunity for these stakeholders specifically to actually provide additional information, because what we're seeing is what inevitably is going to happen here is an adverse effect, where and this is the real problem here, is the fact that these people aren't going to be able to access the services that they really need because of the experience that they've had. And in almost this is, I would even endeavor to say that this is irresponsible of the government. It's actually irresponsible of the government that they're going to be taking money out of the Victims of Crime Fund that is actually going to be helping the people who've actually experienced these crimes, that they're victims of these crimes. And of course, we know that people who have gone through this experience are traumatically affected. And we do know that through studies of what happened to people who experience these types of crime, that this trauma stays with them for a very long time. And then, of course, if they don't get the supports that they desperately need, it could lead them down a path that will actually inhibit them in terms of their quality of life. It could drastically affect them. We know that there is a high risk of people who experience trauma to actually become addicted to alcohol and drugs. So without having the proper benefits and supports through the nonprofit organizations that actually focus on helping these survivors of these, and sometimes in very horrendous crimes. I believe it was the member from Edmonton Whitemud, it was Edmonton Highlands Norwood, or perhaps both of them were speaking to this at one point or another. But the fact that children who experience these horrendous crimes happening, imagine the kind of the effect, the trauma that would actually be experienced by these children who experience a violent crime, which is often in domestic violence situations, one parent over the other, and how that would incredibly affect those children and the supports that they're desperately going to need in those kinds of circumstances. So while we agree, as I state, while we agree with what the government is trying to do in terms of provide additional funds to alert, rapid force, of course, drug treatment courts, and hiring more Crown prosecutors, we ask, why does it need to be done at the expense of taking money out of the Victims of Crime Fund, which will actually help people that are actually going through this type of trauma? And as I stated, I would categorize this as incredibly irresponsible of the government, because it's going to create a void where people who actually need the help aren't going to be able to get it. And we've heard the Minister of Justice and the Solicitor General get up in this House several times and talk about specifically rural communities, and the fact that people experience these kinds of crimes and that they are indeed traumatically affected. So we can't understand why then you would take money out of the Victims of Crime Fund to do this. So what's drastically needed here is for members of this cabinet, and specifically the Minister of Justice, to actually hear out these nonprofit organizations, other community groups, Indigenous communities, when it comes to this specific issue, because I think that, and we highly believe that this cannot go underfunded. So this is an incredibly important priority that the government should be looking elsewhere to find where they can take money from. And I would even endeavor to say, okay, we know that you've given money to corporations, and the question is, okay, well, how much is actually going to be taken out of the Victims of Crime Fund? How much money is actually going to be taken out of there so that they can then put it into alert, rapid force, drug treatment course, and hiring more Crown prosecutors? And want to encourage the government that perhaps they just don't realize the importance of the programs and that are being offered by these nonprofit organizations, and they actually desperately need the financial support so that they can provide supports to the individuals that have actually experienced these horrendous crimes, and especially children. So it's for this reason that I want to highly encourage all members of this House to support this particular amendment that was put forward by the member from Calgary-Buffalo. But I also wanted to highlight as well, just I believe here, just some additional background on this. So in the October budget of 2020, or budget 2019 forecast, a reduction of the funds of the expenditures for 43 million to 28 million by 2021. And so what we see is that this government has already started underfunding this particular program. And I just don't understand why the minister hasn't been able to get up in this House and talk to the particular questions that we've been asking in terms of this bill. And I can tell you that God forbid that any one of us should have actually to experience something like this. I haven't experienced anything like this firsthand, but I can tell you that through what I've heard from constituents who've actually experienced it, is that it's trauma that ends up affecting them for their entire life. And if they don't get the necessary supports, that they end up being severely affected. And if they don't have the supports, then it could be actually crippling, where it would affect them in terms of their daily life. It would impact, whether they go to work on a daily basis, all of these things. So it's so important that we give these nonprofit organizations the opportunity to actually, or that they be appropriately consulted, because that's what we're really talking about here. Again, I stress the fact that we don't know anything. We don't know anything about how the government consulted on this particular bill. We don't know who the government consulted with, when they consulted with them, what they learned from those consultations, and if any of that is actually reflected in this bill. So I think it's really important that we give an opportunity for the government to actually hear from these nonprofit organizations. The other thing that I want to, being from Edmonton Ellerslie is, and I always bring this up, is the fact that it's also important to provide culturally or appropriate supports. And this is something that perhaps the government hasn't considered, right? It's like people from different ethnic backgrounds and then specifically religious backgrounds are going to experience things in a different way and understand them in a different way because, of course, they come from a different kind of life philosophy. And I give you the example of, not particularly related to this, but it's just an opportunity to kind of just highlight how people coming from a different religious background will actually experience trauma. And I remember it was probably a good 3 years ago now that a member, a constituent from the Sikh community came to my office and because his mother was actually passing away in the hospital. And basically his mother was non-responsive, and the doctors had the mother on life support, and basically were just waiting for the mother to pass away. But of course, the family and within their own religious philosophy, this was just not acceptable. I think that for all people, you'd want to make sure that people will fight until the bitter end, as they say. But specifically, I know that in the Sikh religion, you just don't give up on life. And I remember having, very well, I could tell that this individual and his family were just traumatized by this whole experience. So it's really important that.
Thank you, Honourable Member. 29-2A is available. Should I see the Honourable Member for Edmonton Northwest is written?
Well, thank you, Mr. Speaker. And, I couldn't help notice that my esteemed colleague was in the middle of a sentence. And he always tells such interesting stories that relate back to the issue at hand. And so if he could be so kind to finish that off, I would be grateful.
The Honourable Member for Edmonton Ellerslie.
Thank you very much, Mr. Speaker, and thank you to the member for the opportunity to finish. Because of course, as I was stating, the family was traumatized by this entire experience. Now, if we were to apply that same understanding and the knowledge that we gain from this experience to the Victims of Crime Fund and how it's really important that we give nonprofits an opportunity to actually relate the experiences that they've had. You know that I'm sure that they deal with a great number of people from different backgrounds, ethnic backgrounds, religious backgrounds, and how they would approach providing people with the supports and assistance that have experienced this type of horrendous crime would also be a factor. So we don't know because, of course, as I stated, the minister has not provided any of these kinds of details on who they have consulted with, if at all, with nonprofit organizations and community groups, and who's actually going to be missing out because the supports are no longer going to be there. Now, I was just, in speaking to this, into a previous amendment last night, I was talking about the fact that these non-profit organizations often exactly help out people from different ethnic backgrounds, and that the Alberta of today looks very different than the Alberta of 50 years ago. And I was speaking specifically, Mr. Speaker, about the fact that we have a much higher population of people from diverse backgrounds, right? And moving forward into a more modern Alberta, we need to make sure that nonprofit organizations are given the supports so that they can help people from diverse ethnic backgrounds and diverse religious backgrounds, and that expertise is actually supported. So by taking money out of the Victims of Crime Fund and the actual support for these nonprofit groups and additional community groups, we're putting at risk the actual supports that can be provided. And my fear is that because we have we have no information on who the minister or staff actually consulted with, we don't know the reality. And this is why it's so important that we actually take an opportunity to get this bill right and actually provide nonprofit organizations and community groups the opportunity to actually provide this feedback. I don't think it's too much to ask. I think that, especially because we're, you know, and I discussed this last night when we were speaking specifically to the ethnic makeup of Alberta. In the next 10 years, we know it's forecasted that people from diverse ethnic backgrounds in Alberta will actually grow to be 50% of the population. Alberta is going to look very different in another 10 years than it actually does right now, or how it did 50 years ago. And I think that it's important, you know, and especially as a member from a diverse religious background, you know, we have many here in the House, is that we be able to provide supports to Albertans, specifically from these diverse religious backgrounds. I have a good friend in the Muslim community. His name is, he's actually the outreach imam for Al Rashid Mosque, and is actually a social worker, Brother Sadiq Patan, wonderful member of the community.
Thank you, Honourable Member. Are there any other honourable members looking to join debate on RA1? I see the Honourable Member for West Henday, of course.
Thank you, Mr. Speaker. It's an honour to rise to speak to the amendment before us that Bill 16, I believe, I don't have it in front of me, but shall not be read a second time at this time, recognizing, as many of my colleagues in the NDP caucus have, that there is major flaws in this legislation. And you know, looking back at some of the news reports that have come out since the introduction of this legislation and since this conversation has started, I believe I commented on this the CBC article in my previous speech, but I think it's very relevant and it bears repeating. On May 28th, the CBC reported that the UCP government planned to get rid of its current injury benefit, as well as the witness to homicide benefit, a one-time payment of $5,000 to people who witness the killing of a loved one. And so I think it's important that we take a moment to reflect on that statement, that we're going to actively be taking benefits away from people who have witnessed horrendous crimes that will most definitely impact them and potentially change their lives for the worse for the rest of their lives. And so we have a UCP government telling us that Bill 16 is about strengthening the ability to get resources to victims of crime, but in the other breath, they're saying quite plainly that they're pausing these benefits and that at this time they're removing these benefits. And the article goes on further to say that instead financial benefits to victims of crime have been narrowed to people who have experienced severe crimes. Narrowed, Mr. Speaker. So once again, we have the government saying that Bill 16 is strengthening the ability to get these funds to victims of crime, but on the other hand, in their discussions with the media and with the public, they're actually explaining the truth that they're narrowing the ability for this money to be sent out to people. And so the minister went on to say that we're pulling back these funds a little bit in the interim until we get feedback from the two MLAs who are going to be on this panel to come up with a new model for Victims of Crime Fund. And while I I appreciate that there is need for movement on this issue. While the Victims of Crime Fund has served our province, I would argue, quite well for several decades, I think that we can always aim to do better. And I truly hope that that's what this government is moving on doing. But the problem is that in the meantime, these people are left with nothing. So I don't understand how we're expected to vote in support of this Bill 16 and say, yeah, you can pause these benefits for victims of crime, and hopefully you'll come up with something better in the future. Now, once again, I support the idea of strengthening this fund, but what we've seen and what we've heard from this minister, which is very little, has not given us any confidence that we are moving in the right direction. I think back to a conversation, a meeting I had with a constituent who came into my office, and they were advocating for somebody else in their community because they had been the victim of a collision that left them with life-changing disabilities. And they were advocating to me that, considering that it was a drunk driver that did this to them, that they should be included in the Victims of Crime Fund, which, as the Alberta government website states, is not the case in many instances. And so this person was advocating to me because the person who was injured was not in a position to advocate on their own behalf. And that is one of my biggest worries about any changes to the Victims of Crime Fund, is that we are going to negatively impact these people who are not able to advocate on their own behalf. And when we look at some of the reasons that Albertans are able to access the Victims of Crime Fund, whether it be damage or destruction, loss of property, bodily or psychological harm, lost wages because of injuries, whether psychological or physical, funding for services like counseling or psychologists, expenses incurred in moving out of offenders' houses, somebody that's been victimized by potentially a domestic partner, needs funds, and they need reassurances from the government that they will be protected if they try to make this transition. But once again, we have this minister saying there's no more funds in certain instances for these people to gain access to these programs, and trust us, we'll deal with it on the back end and it will all be okay. But unfortunately, Mr. Speaker, that does not work for the people who have been victimized across our province. Now, there's been many articles, like I said, from advocates across many industries, and one in particular that I see, Alf Rudd, who has been very outspoken on this issue. A person who has over 5 decades of law enforcement experience with the RCMP, Tabor Police, the Blood Tribe Police, and is currently the president of the Alberta Police-based Victim Services Association. He calls this a ploy to raid the fund. And goes on to explain that this fund could disappear very quickly, or the surpluses specifically in this fund could disappear very quickly if the minister decides that the best use for the surplus is to go specifically to policing or to prosecution. And while I recognize the importance of ensuring proper funding, especially when we look at rural communities. We have these conversations about wait times for communities outside of urban centers, and I appreciate that more needs to be done. But what we've heard from this minister is little more than lip service, Mr. Speaker. What we've heard from this minister is announcements of extra policing going to, I believe the number was 500 extra RCMP on the streets of rural communities. But he didn't include any extra funding. The extra funding he included was to actually take more resources from those communities and resell it to them as if it was some new funding. And so that is a massive concern for me. The conversation that we should be having, instead of talking about narrowing what these funds are for, or pausing the witness to crime benefit, is how we can expand these funds to communities. Once again, recognizing that rural communities are especially affected in wait times and services for their communities, why aren't we talking about ensuring extra funding, extra education, whether it be for the community whether it be for the policing services, and most importantly, for the victims of these crimes themselves. Crime is high in these communities, which means payouts and services for these victims should go hand in hand with that. So why aren't we talking about ensuring that we are expanding the scope of the Victims of Crime Fund? And while I appreciate the minister may or may not come back to say that's what we are doing, the problem is that we have not seen that. It's not included in this legislation, specifically what the minister plans to do with this funding. I spoke to some extent of some of the other nonprofits that are going to be affected by changes here, or at least are concerned about changes. On May 25th, these organizations wrote to the Premier, the Alberta Council of Women's Shelters, and the Association of Alberta Sexual Assault Services. And, in my last speech, I also spoke of, I believe it was the John Humphrey Centre. I'll take a moment to confirm that. But these organizations are very concerned about their funding, because not only now is the minister having a conversation about changes to funding of these organizations that may have accessed supports through the Victim of Crime Fund to ensure that these victims are getting the supports they need, they've also had their funding cut on the other end. Whether they're accessing, community-based grants through this government, something that we've seen decimated with very little consultation. Well, I would say absolutely no consultation, especially when we look at the problem of us not having the opportunity to question this government as much as we should have been able to, and the undemocratic moves that this government has made in limiting our ability to question them on their budget through the estimates process, which was essentially eliminated entirely. And so I would like to take at face value that this minister is going to expand this fund to ensure more victims of crime are being supported through this program, but we haven't heard that from this minister. We've really heard very little. And, from what I can see, there hasn't been a response made to these organizations to provide reassurances that their funding wouldn't be affected. But this seems to be a pattern from this government, that they change the way that funding is given out, whether it be the changes to the lottery fund moved to general revenue, whether it be the massive cuts to CIP and CFEP across the province, incredibly important funds for the education and infrastructure and really the community well-being across the province. These programs have been decimated by this government, and with very little transparency at all to move those lottery funds to general revenue, to talk about moving victims of crime funding to fund this or that without any reassurances or any proof that it's actually going to be spent on programs that they said they will be spent on. I'm really not sure how we're supposed to take that and just support it. And so that is why, once again, I'm supporting this amendment that's before us. I think it is in all of our best interest to take some more time to reflect on the importance of this fund, to reflect on the ability to expand this fund to ensure that the money is actually making it to the victims of these crimes, the people who need this money most. But that has not been the conversation coming from this UCP government. And with everything that has been going on across North America and across the world, there has been increased calls for transparency in how funding for police and services that wrap around police are being spent. People are asking for more transparency. And this is not a move in the right direction to ensuring that transparency is there. Now, I really hope that the minister will take some time this evening or very shortly to explain what really he has in mind for these funds, because we have not gotten any explanation up to this point. And many of the people on this side of the House in the NDP caucus have raised that important point, that we're being asked to vote on a piece of legislation which has had very little response from the Justice Minister. And it's simply not okay. It's not okay that we be expected to vote on this with very little conversation. You know, I think about the people, whether it be that person that walked into my constituency office or the people across our province that have been victimized. And I'm not sure how I'm supposed to go and tell them, like the Justice Minister did, that, sorry, there's no funding there for you because we narrowed the scope of the fund, because we paused the fund until we come up with answers. We don't have any answers right now, but hopefully one day we will. And hopefully one day you'll get the funding that you deserve for being victimized. And I can only imagine that those same constituents and people across Alberta will be re-victimized because their government was not willing to ensure that the funding was there for them. Instead, they have a government that says, with the massive surplus that is there that should be reinvested into victim of crime funds, we have a UCP government that says we need to ensure sustainability. Really, what we've seen, whether it be cuts to healthcare, 20,000 layoffs in education, sustainability to this government means no one gets anything, and there will be money left over on the budget bottom line at the end of the day. But people need this money today. They don't need to wait for the review to come back and hope that there's money there for them. It really is a pattern, Mr. Speaker, that we're seeing from this government, and it's very frustrating. It's frustrating to have to go back to my community and not have the answers for them. I don't truly understand how some of these UCP MLAs are able to go back to their communities, whether it be, proposed cuts to HALO funding or proposed cuts to education in their communities or hospitals and healthcare and the loss of doctors, how they can go back to their community and say, I did my best, but really, this premier it wasn't in the cards. So now we're going to lose physicians in our community. Now we're going to lose hospitals. Now we're going to lose victims of crime funding in our communities. I truly don't know how members can go back and reconcile that fact with their community and with themselves. I was put here for a second term to continue to fight for strengthening the programs that are offered by government, not for weakening them. And that is something that I take to heart every single day. And, you don't always get it right, but you should do your best to do that. And unfortunately, this UCP government has got it wrong more times than they've got it right. So once again, I hope that everyone will take the time to consider this very reasonable amendment. I think it's the right thing to do in the current context of the backlash that we've been hearing from organizations that receive funds through the Victim of Crime Fund. The experienced people.
Thank you, honourable members. 29-2A is available. Seeing none, are there any? Oh, I actually did see the honourable member for Peace River.
Okay. Well, thank you, Mr. Speaker. I was struck by the speech, a few different moments. The honourable member from Edmonton West Henday brought up concern about a pattern of history within our government. And I want to take a 30,000-foot view, Mr. Speaker, of a pattern of action from the opposition members during second reading. And I'm wondering if they paid attention during their introduction to the legislative process that the member, as you referenced, is re-elected, so it would have been 2015, the member from Edmonton West Henday. Second reading, Mr. Speaker, as we all know in this House, or ought to, is the reading where we analyze in principle whether or not the legislation is something we support. We have a process. In Alberta, we use the Committee of the Whole. Other legislatures use other processes through committees to amend in detail. So I'm very excited when I hear in second reading, in these debates of amendments or in the debate itself for second reading on all sorts of legislation, when the members opposite get up and say, I support choice in education, or I support helping, find efficiencies in program X or Y. I support finding innovations to better serve our constituents and victims of crime. But I just don't know if I like this comma here or that detail there. Mr. Speaker, we're very lucky to have the legislative process handed down to us from centuries upon centuries of work from our ancestors. Here in Alberta, here in Canada, and before that across the ocean in the United Kingdom. And in that process, it is in the Committee of the Whole where we're allowed, or committee, whatever legislature it happens to be, we can make these amendments. So I'm very excited to see that the member supports, and I can only imagine after we, rightfully now that we've corrected this wrong, Mr. Speaker, and defeat this proposed amendment, the members opposite, including the member from West Henday, because he supports in principle the intentions of the minister, but just isn't sure that there's enough detail in the legislation, will propose the substantive amendments in committee of the whole and vote for the legislation in second reading. It's going to be terrific to see a sense of bipartisanship in the legislature. As the member from Edmonton Whitemud mentioned often early on in her term since being elected in 2019, maybe she's forgotten some since then, but I'm hoping this bipartisanship will continue. So I'm looking forward to that vote together, supporting, Mr. Speaker. A few other moments in the speech that I'd like to highlight is the concern that they have, the conversation we should be having, Mr. Speaker, says the member from Edmonton, West Henday, is to expand these funds to more communities. Well, I believe that what we're doing is expanding it, because there is not one community member, no matter what their religious or ethnic affiliation might be, that does not benefit from the prevention of crime, Mr. Speaker. With the expansion of the rapid and alert systems, the ability for us to fund them, in my community, I can tell you, whether they be a member of the Sikh, the Christian or Muslim or any other faith in my constituency, in rural Alberta, they all suffer, regardless of their religious affiliation, from the scourge of rural crime. That has been mounting. It's a wall slowly moving north, Mr. Speaker. A few years ago in Manning, you would not have found the kind of crime you find now. In a few years more, we'll see a high level in Lacrete in the northern edge. This scourge continues to push. And it does not matter whether you're on a reserve or off. They don't want rural crime. It doesn't matter what your ethnic affiliation is, Mr. Speaker. And that is why this is one of the best possible things we can do for victims, is prevent them from becoming victims, Mr. Speaker. And when I speak to victims in my constituency, or family or friends of mine who have been victims of crime, rural or otherwise, urban or in the more far-flung northern communities of our province, they all agree with me. And they say, of course, I'd rather not have been a victim. I'd much rather that we had a response that could prevent and deter these sorts of situations from happening. And they're not small instances, Mr. Speaker. Some of them are small petty crime, which obviously is regrettable. But as we heard from the the member of Grand Prairie in her member statement last week, there are tragedies, absolute human tragedies that happen. And we cannot write that off, Mr. Speaker. And if we can prevent even one of those instances from happening in my community, I'm in. I'm in 110%, Mr. Speaker. I'm in every day of the week, 7 ways from Sunday. And this is what I'm hoping we can see from the members opposite, is that bipartisanship, collaboration, that we can work together on this issue, because here in second reading, we're looking at, is the intent of this the right direction? Is the intent of this right? It seems to me that the speakers continue to try and walk both sides of the fence, Mr. Speaker. They say, I like the idea of trying to prevent crime. I like the idea of supporting alert. I like the idea of supporting rapid, but I'm just not sure I want to do it right now. I'm concerned about that, Mr. Speaker.
Thank you, honourable members. Are there any order? Order, honourable member for St. Albert. Order. Are there any honourable members wishing to speak to RA1? I see the honourable member for Lethbridge West.
Well, thank you, Mr. Speaker. I'm rising to speak to the reasoned amendment on Bill 16, Victims of Crime Amendment Act. And I'm going to begin some of my comments with an email I just got from a constituent, I think yesterday. Dear me, I won't say my name. I am writing with regard to a news item I saw today about ECP taking some funds reserved for victim services and putting those towards policing. I have a personal bone to pick. I was once given access to a victim services counselor after a traumatizing event in my life where RCMP needed to be called, and she really helped me. I do not know where I would be today if I hadn't had access to that service. I truly may not have entered grad school and subsequently earned my master's and PhD. The repercussions of removed victim services funds could be far-reaching and terrible. I'm horrified to read this news. I want to register my fury. So that is from a person who has just moved to Lethbridge from Calgary. And yeah, welcome to Lethbridge. And you write an email, you get it read into the record in the legislature. I mean, this is the sort of thing, though, Mr. Speaker, that this government has not provided any reasonable answers on is what kinds of services are going to be provided as a result of these changes to the disbursement of victims of crime funds, because there hasn't been a demonstrated record of consultation with the community. And that is why we need to, we have proposed, or my colleague from Calgary Mountain View has proposed a reasoned amendment on this piece of legislation. Furthermore, that we don't know, Mr. Speaker, the actual effect of the changes of the financial benefits on victims, because a number of the injury compensations have been removed. Mr. Speaker, many of the injury benefits that were based on injury type are being proposed to be removed by this piece of legislation. It used to be that, for example, if you were a kid in care and you were sexually assaulted by your foster parent, that you could apply to the Victims of Crime Fund for a restitution, a financial benefit for the fact that you suffered a crime at the hands when you were in the care of the state. Mr. Speaker, and these are kids who oftentimes don't have any extended family to help them through, don't have any of the other social supports. And so that money meant something and means something to this day for all of those kids in care that have suffered at the hands of their foster parents, and there are too many of them to count. So when you remove that financial benefit and you say instead, well, here's 4 counseling sessions for your trouble, no, that doesn't reflect my values, and I do think we need a reasoned amendment, and we do need to send this bill back to the drawing board. It is absolutely unacceptable that we would be pulling the rug out from underneath victims in that way. You know, Mr. Speaker, I note that there have, in fact, been a number of lawsuits around this matter, and in particular around kids in care who have not had access to the Victims of Crime Compensation Fund. And in fact, there was a class action lawsuit that wound its way through in 2015. It was a little bit, I think, messy and unclear as to the kind of justice that those now adults, children in care, what kind of justice they actually had access to as they were victimized serially by being in care by their foster parents. Some of them got between $15,000 and $30,000, and I'll just read you a quote for the kind of treatment they had. For a fellow who lives on Elizabeth Métis settlement near Cold Lake, here's a quote from 2015. Marty and his younger brother grew up in care wards of the province for 7 years. I lived in 36 different foster homes and group homes. I was sexually molested. I was beaten. I still suffer from childhood post-traumatic stress disorder. And that class action lawsuit was around the government's refusal to apply to the Victims of Crime Fund for the benefits that those now adults were entitled to. So if we're going to start cutting off those kinds of financial benefits for people who have suffered, then we can look forward to more lawsuits, more suffering, more intergenerational trauma. Completely unnecessary, Mr. Speaker. Completely and entirely unnecessary. What we need this bill to do is make sure that those financial benefits are commensurate, that they are proportional to the harm that was done by the perpetrator of the crime, that they accurately follow the person's actual needs over the course of their lives, that they allow that person to turn the page on their victimization. And 4 counseling sessions doesn't cut it, Mr. Speaker. If you get beat up by your husband for 20 years and you finally have to leave and you don't have any money of your own, doesn't cut it. We need to have proper financial benefits for injury, Mr. Speaker, and people pay into that Victims of Crime Fund. Those benefits should be going to victims. Now, there is no doubt that there are some communities that do not have adequate law enforcement coverage, particularly rural communities. There's no doubt about this.
And there is no doubt that in particular for some communities we have seen response times and so on and investigation timelines go on too long in both cases. And that is why some of those targeted investments via the cooperation with the RCMP that we undertook between 2017 and 2019 resulted in a reduction of a number of different types of crime because they were targeted investments in law enforcement to solve specific problems for both getting rid of the bad guys and the serial offenders, but also keeping communities safe in a preventative way. These things are not mutually exclusive, and the fact that this government has set them up as mutually exclusive, you can either have law enforcement or you can compensate people who are sexually molested in care. That's not a choice. That doesn't reflect anyone's values. I'm not sure why we're having this conversation, and that's why we have to set it up to send this bill to a reasoned amendment. Now, this idea that we're going to just wait for the financial benefits schedule from some period of time later on, that is pretty cold comfort. If you are a witness to a homicide right now and you've just lost your $5,000 benefit, as a result of what's being proposed here. That is pretty cold comfort to a sexual assault victim, Mr. Speaker, to even a serious break-in entry, robbery, and injury that is sustained as a result of that crime, Mr. Speaker. People deserve to be compensated, and that is why we have the Victims of Crime Fund in the first place. But that is also, Mr. Speaker, to make sure that we are both compensating people on the one side, but also adequately supporting them. That's why we need to talk to the victims' services organizations. I have met with mine in Lethbridge, that sort of serves the whole corridor, many, many times over the last 5 years. An amazing group of volunteers sustains those services. And they accompany law enforcement to some of the most difficult situations that human beings ever face, where we have violence, where we have trauma, where we have both the worst of humanity in terms of people being victimized, and their job is to bring out the best in terms of our resilience and our recovery and our plan to find justice in a system where hopefully they will find that justice in the courtroom, Mr. Speaker. And so this idea that we're going to just completely do a rewrite on how those organizations are funded without even talking to them and setting their needs and their long-term sustainability for funding and development of new programs, perhaps in rural areas or in Indigenous areas or in places where we have certain groups of folks who need specific linguistic services or whatever the case may be as those needs change over time. The fact that we're just going to yank a bunch of money away, say, yeah, we might have a plan later, but we don't have a plan now. Don't worry, you're not going to get any funding if something bad happens to you because we've just taken away all the injury benefits. Here's some counseling. Talk to you later. That is not at all consistent with either a victims centric and an approach in our system that actually turns a victim into a survivor and recasts that person's experience in a way that they can go back out into the world with strength after so much has been taken away from them. That's the job of the Victim Services volunteers, both in the first instance and in those moments where everything is so crucial, where that trauma is happening right there and then, but also in the months after, in the years after. So this notion that we're just going to rewrite the programs without any at all conversation with these volunteers that do this, with people who have gone through these systems and who have told us, yes, this worked, this didn't, do this, don't do that. That's the kind of work that should be going into this bill. Because if we actually want to be tough on crime, we need to be soft on victims. And we need to be soft on the kinds of things that bring us together. Resilience is not something that comes, you don't get that through an iron fist in a courtroom. You get that through a social services response. You get that through an actual healing and compassion and counseling and actually, yes, access to funds to rebuild your life. So, Mr. Speaker, this bill should be subjected to a reasoned amendment as proposed by my honourable colleague, the member for Calgary Mountain View. There's another reason it ought to be so as well, and that is there is a long history of conversations with victim services organizations, with municipalities, with other organizations such as sexual assault centers, such as immigrant serving agencies, such as the Child and Youth Advocate, for example. There are all kinds of organizations that are both in the nonprofit sector, but also attached in some way to some level of government, whether it be the provincial government, municipal, or some of the values that were articulated in the Victim Bill of Rights that is in effect at the federal level. Those conversations had been had, and they had been had by the member for Calgary Mountain View. So it is not as if this is new territory. There is no question that there was a surplus building up in the Victims of Crime Fund. The Auditor General found this very, this is not news to anyone. The question is, what do you do with it? And do you use those funds that are paid as restitution by people who are convicted of an offense? They've paid their debt, and then they have to pay a fine too, and they do that because we have, as the member for Calgary Mountain View says, the victim is not necessarily in the courtroom. This is a recognition that the victim is an important part of that justice system. And it has been historically a blind spot of our justice system, that the Crown seeks the justice, but the victim doesn't always feel it. The other set of questions I would have around this is, how does this affect Indigenous justice systems? How does this affect the funding for, and this is just a set of open-ended questions, and is something that I would like to see come out during consultation, because I certainly haven't seen the Justice Minister talk about it. How does this affect sentencing circles and community response to crime? Again, this is a different worldview in an Indigenous justice system. We see it in effect in many communities, where that actual reckoning with the contravention that the perpetrator does with the victim in that room, or the victim's family, or whatever the case may be. It's often, it can take different forms in a sentencing circle and in a real process of restitution and paying back one's debt to one's community. How do these reductions in victim services funding, because they are reductions in favor of other uses of the fund, how are those programs affected? And has anyone, even asked the question? I'm asking the question now, and it forms the basis of the case for proceeding with a reasoned amendment, Mr. Speaker.
Thank you, Honourable Member. I will remind the Honourable Member to table the email that she referred to at her earliest opportunity. 29.2a is available should anybody be looking to partake. Seeing none. Are there any honourable members wishing to speak to Amendment RA1? I see the Honourable Member for Calgary McCall has risen.
Thank you, Mr. Speaker, and I rise to speak to this referral amendment that Bill 16 be not now read a second time, because the Assembly is of the view that additional consultation with organization providing support to victim of crime is required. It's an important amendment, and I think I want to remind the government, when they used to sit here, they will focus on consultations, that how consultations are important to get things right. And here, we have a good case for consultations as well, because the leading group that represents Alberta's 73 victim service organizations, 73 organizations from across Alberta. The president of that group is saying they were not consulted about it. That's unfair, and that's government doing something without any consultation whatsoever with those who are on the ground, who are providing these important services, who are supporting victims, who are supporting communities, indigenous communities, racialized communities, for over 2 decades. And government is completely ignoring that group and moving ahead with the changes that nobody was asking for. And the only reason that they are doing these changes is that in their budgets, they imposed deep and reckless cuts on policing and municipalities. And now they see a pot of money and now they are taking that to pay for their cuts. Like, I'm totally in favor of government supporting Alberta Law Enforcement Response Team, ALERT. I'm in favor of government hiring more prosecutors, 50 Crown prosecutors. I think ever since this government came into the power, I've been hearing those 50 prosecutors an invitation to come to Rocky Mountain House, but didn't see anything concrete until now. And I support funding for rapid force to tackle rural crime. In providing safety and security for Albertans, that's the fundamental obligation of any government. That's the responsibility of this government. But in so doing, they shouldn't be taking money from the victims of the crime because they were wronged as well. And since they were wrong, it's government responsibility to also provide them supports so they can heal. That's also government's fundamental responsibility. So it's not appropriate for the government to take money from this fund and pay for their cuts. And those organizations are even using words like that the government is, and I quote, raiding the Victim Services Fund. And the President, Mr. Rudd, is pleading this government to put a stop on it. Let's have conversations. But this government has earplugs in their ears and not willing to listen. And now we learned that government is setting up a working group co-chaired by 2 government MLAs to do consultations on new victim assistance model. I think in the first place, nobody was asking for this new model. It's just government is creating more or some work for their own MLAs. And now if they have set it up, why not then hear from all these organizations who are speaking against this bill. So if this amendment is accepted, I think this will put a break on it for now and will give these working group co-chairs an opportunity to reach out to these organizations and actually listen to the folks on the ground. Actually hear from those who are serving victims from last 2 decades. There are many other concerns that have been raised. Defense lawyers, they have raised concerns on accessibility, affordability of justice, and supports for legal aid. Government didn't do anything about that, while I'm proud to be part of the government that revamped legal aid and put additional resources into legal aid to make sure that those who are victims, those who are less fortunate among us, they have resources to access justice. Similarly, Alberta Council of Women's Shelters, a group that represents all women's shelters across this province and provides critical support to those who are surviving domestic violence and supports to their children, their families. They have raised concerns how this government is taking money from this fund to pay for their cuts. And if we pass this amendment, hold on to this bill, that will give us an opportunity as well to hear from people at Alberta Council of Women's Shelters. Then we have seen Alberta Association of Sexual Assault Services. They also raised concerns about this bill. They also wanted to make sure that the funds from this Victim of Crime Fund are going to supporting victims. And I think they deal with some of the most serious issues facing our society, and they deserve to be heard by this government. They represent victims and survivors in all those organizations. Not only those organizations who are, not only the group that is representing Victim Service Organization, but organizations such as Alberta Women's Shelters, Alberta Association of Sexual Assault Services. They are on the front lines. They are dealing with victims and survivors of crime on a daily basis. They know what their needs are. I think they deserve to have a say how Victim of Crime Fund can be better utilized to help those Albertans heal. And instead, government is taking that money from those victims to pay for things that none of these groups agree with and none of them were consulted about. And it's not just that they are taking money away, they're changing many things in this bill that will change fundamentally the eligibility criteria for these victims, how they will qualify for these funds. Again, an important issue, and all those who are serving victim serving service organizations, they have things to say about that, and they should be invited by this government to weigh in on these issues. They're talking about changing mandatory surcharge, and they're also eliminating some services. For instance, government is eliminating the injury and witness to homicide benefit, which means the Criminal Injury Review Board almost will get eliminated. These are some serious changes. And what these changes mean, that those who witness homicide, they may not get any benefits. And I think it would be nice to hear from anyone from the front bench that why they think that this is a change that we should move ahead with. What's evidence out there supporting this change? We can stand here and argue about the impacts of someone witnessing a homicide. We can talk about the trauma. We can talk about the psychological impact that it has on individual. And with the advancement in literature and science, there is, I guess, more evidence to support that unless we treat those things properly, unless we have proper supports in place for these kind of things, that trauma can even be intergenerational. There is enough literature about it. The most prominent example will be that those from indigenous communities in particular, those who were taken from their home, were taken to residential schools, and the injuries and harm they suffered there, there is enough documented evidence that the trauma they suffered has impact on their generations. And there are many issues that are present and prevalent in our indigenous communities are resulting from that intergenerational trauma. And at this point, we should be focusing more on using that fund, this fund, to support those who were victimized and not taking it away from them. Thank you, Mr. Speaker.
Honourable members, Standing Order 29-2A is available. If anyone has a brief question or a comment for the member from Calgary-McCall. Seeing Bueller? Seeing none, is there anyone else wishing to join in the amendment debate RA1? The Honourable Member for Edmonton-Rutherford.
Thank you, Mr. Speaker. I appreciate the opportunity to speak to this bill, as it has some serious flaws, and I think absolutely needs to be referred for further work before it is passed in this House. And I want to take us back to about 30 years ago when this Victims Crime Fund was originally established, and talk a little bit about the social contract that was inherent in the decision to create a fund in which people who had been involved in violent criminal activities were paying monies into a fund to help the victims that they had caused such great trauma. And I think that's important for us to understand what the intention and notion was in the establishment of this fund. The underlying social contract was one that said, if you have been a victim of a violent crime, inevitably the consequence for you is deep and personal trauma. Now, we all know that to be true. The types of crimes we're talking about are crimes such as physical assault, sexual assault, rape. All of these kinds of crimes inherently have in them significant, long-lasting effects for the people who have been victimized by these crimes. If somebody comes onto your property and steals your bicycle, it is upsetting in the loss of monies and so on. But it's more upsetting to know that somebody violated the integrity of your space, your home, to have something taken away from you. Now, how much more is the sense of personal violation, the sense of violation of your bodily integrity to be a victim of a violent crime? How much more will it lead to you being unable to address the world around you with a sense of personal safety? That's the issue that's at hand here, that violent crimes result in dramatic and traumatic consequences to the people who have been victimized. And frequently, those trauma experiences become lifelong trauma experiences. As a therapist for many years in the area of child sexual assault, I witnessed many people who had experienced sexual assault, mostly in the work that I did, young people, children and adolescents. And I can tell you that while we worked very hard to resolve the issues inherent in having lived through that kind of distressful experience in your life, inevitably we were never able to say to a victim, that problem is done, it's solved, you're fixed, go away. That's not how it works. What happens instead is you work very hard to help that individual to create for themselves the tools to continue to address the outcomes and consequences of that violent assault. You can never say the trauma is gone. Rather, now what you're saying, the end of good therapeutic process, is while you will continue to have that trauma as part of your historical experience, it no longer needs to be a trauma that defines the nature of yourself and your life moving forward, because you have the ability and the tools to frame it in such a way that you feel in control of yourself, you feel in control of your body, and that you are re-empowered to live a full and satisfactory life. That's what we're talking about when we talk about victims of crime. We're talking about getting to the place where they're able to live a satisfactory and full life. And that can only happen through significant intervention. We know that people who have undergone these significant traumas very often end up by having secondary issues in their lives. That the initial trauma was one of sexual assault, but the ongoing repetitive trauma for the rest of their lives are traumas associated to their coping mechanisms, such as the use of drugs, the use of alcohol, perhaps gambling, or some other dysfunctional mechanism of dealing with the trauma that they have experienced. And because we recognize that experience for people who had been traumatized, we as a social contract in society made the decision to ensure that the people who perpetrated that trauma were contributing to the resolution and the support of people who had experienced that trauma. It's a recognition of how that trauma got created and tying the cause of that trauma to the effect of that trauma. That's what this program was all about. It was never about government seeking a new tax for its own resources, for its own decision-making. They could have done that. They could have simply said, oh, what we'll do is we'll simply increase individual or corporate taxes by 0.25%, and we'll take that extra dollars and we'll put it toward victim services. That would have been an alternative, but they didn't do that. They didn't do that because it's about the social contract, understanding the connection between perpetration and victimization and the resulting trauma. That's the basis of why we have this program. And now, what we have instead is a government saying, this is not about that social contract anymore. That the basis of our actions is not about the trauma you're experiencing, but rather it's about revenues for the government. Revenues that the government will use to decide to do what it wants to do in terms of other initiatives or other concerns it may have. Now, I know in this case that the government is suggesting that the use of those revenues will be the prevention of crime, which of course I am in favor of. Our government increased monies for rural policing in order to decrease crime. We get that. We support that kind of work. But in betraying this underlying social contract, you're actually breaking the relationship between the cause and effect of perpetration and trauma. And instead you're suggesting that once the monies come in, even though it was not government money in the first place, this is court money taken from offenders to be given to victims, you're now saying that is government money and they can do whatever they want. Today it happens to be reduction of crime through supports of police officers, which I would hope the government would do, but I want them to do it in a different mechanism. And next time they want to do that, next time they see a surplus in a program like this, they may decide to do something else. Maybe they want to build a bridge somewhere. Maybe they want to fulfill some other government obligation, put some people on a board to do something about, the Alberta flag modifications. You've established a principle that allows you to do that. And that is just really not acceptable. I know that there have been some concerns expressed by a number of people about this whole process. For example, Elf Rod, who is the president of the Alberta Police-Based Victim Services Association, has very specifically said, this money was not tax money. It does not belong to you as a government. And now that you're redirecting it toward police officers and prosecutors, you are breaking that underlying social contract. And in fact, he goes on to say, and I'll quote this and I will submit this later on, in terms of this new government and trying to express our concerns to the minister, in particular, we haven't had a whole lot of success with that. Requests for meetings have been turned down. We did get a half-hour telephone conference with him, but it wasn't with the association. It was with some of our association members who were able to get access through various contacts, and that's all we've had. There being no ongoing discussions, no opportunity to ask questions, and no opportunity to participate in consultations when it comes to the uses of the funds, end quote. That's a pretty devastating thing to hear from the Alberta Police Board Victim Services Association. I think that speaks to the fact that people who are central to this have not been appropriately consulted. And less than an hour ago, I got off the phone with representatives of Treaty 8 who clearly told me that Treaty 8 have not been consulted on this. They haven't even been informed about this. I was the person informing them about the nature of this bill. And I'm very concerned that the Indigenous community is yet again being overlooked in a bill that very particularly addresses concerns that they have, because we know that Indigenous people are more likely to be victims of crimes than any other segment of our society. Now, that's a tragedy. That's a failure of the structure of our society that is occurring. And it is incumbent upon us to begin to address that failure by including Indigenous people in the decisions that are going to affect them, which is the basis of all treaties. If we fail to do that, we are betraying yet another contract that we have made, not just a social contract in this case, but an actual physical treaty, a contract with the Indigenous people in this province. And I think that that's a travesty. And I think it's unacceptable that we're here again saying we're going to do something that is important to you as Indigenous people, but we are not going to talk to you about it. I think that's extremely problematic. I certainly would like to see this government take the time to do this properly. Because if they actually said, look, the Auditor General says we have a surplus in this fund, we need to do something about it, they could have taken the time to sit down with the Indigenous people and say, what do you think these surplus funds could properly be used for in the Indigenous community to reduce the trauma that Indigenous people have been experiencing as a result of their overrepresentation in crimes of violence and trauma? They could have done that. And they would have heard Indigenous people talk about things like sentencing circles and community sentencing and the opportunity for victims to confront their offenders and to talk to those offenders about how the trauma has hurt them. Because in the Indigenous community, they have two goals. One of them is the resolution of the individual trauma and the remediation or the correction of the offender's behavior. Indigenous people don't want to simply punish offenders and throw them in jail and throw away the key. They want them to change. They want them to be new people, to be contributors to a better society, to help raise the children in their community in a positive way. And they need an opportunity to sit with those offenders to help them understand the implications of their negative behavior and to offer their support to the offenders to participate in a process of transformation that has positive consequences not only for the victim, but for the offender, and even more importantly, perhaps, for the whole community and the children being raised in that community. That's what it is they would tell you they would like to have happen. And did this government go and say, look, we have these extra funds. We certainly would like to address crime in the Indigenous community from your perspective, to do the things that you would like to see done from your cultural, historical point of view? No, they did not do that. They broke the underlying social contract of crime and trauma and instead used it as a slush fund for other government choices. And I'm not complaining about the fact that you want to increase police services in this province. I get that. But the government has a mechanism for doing that. They have a taxation process in which they can raise funds and provide those funds to the communities. And now they're actually not doing that and making municipalities do that. They're taking money away, and now they're taking it away from victims too. Completely unacceptable.
Honourable members, Standing Order 29-2A is available. I see the Honourable Member for Lac St. Anne Parkland has risen.
Yes, thank you, Mr. Speaker. And I'll make this one pretty brief. I've listened to the last several speakers from the members opposite. Their backgrounds are predominantly in the social services area, and they're very much understanding on the victim services side with these files. I know that they're speaking from the heart, but a few things that are stepping outside that I feel I must speak about is about that consultation process. Now, that kept jumping off, and I heard the member from Lethbridge West talking about consultation, how this government and us as MLAs, we don't do our consultation. I couldn't help to think about the Bighorn parks that are out in that area. And Mr. Speaker, I know you're familiar with that as well, because I had lots of constituents talking about that. So consultation, Bill 6, I think there was a farming act or something that we ended up repealing. I know there was lots of consultation that took place there, because I'm new to this, but I got to find out all about consultation when I heard about that one. Rural crime, we've heard about lots of consultation with rural crime because we were at those places. We had offered those and made those extensions a number of times for folks to come talk about rural crime, to come to our areas. They weren't taken up on that, but we've been consulting on that. How about those coal phase-outs out in Keep Hills, phasing out the coal industry? I was challenged by the member of, Goldbar, I believe, to go out and actually talk to those union members. Well, I did some consultation, talked about the hard things of how we couldn't turn it around, how we couldn't put things back on track because the other group had already gone too far down the gate. When we're talking about, the First Nations group, so the Paul Band, and I know the member from Rutherford was a former Indigenous Relations Minister, so he has lots of breadth and depth to it. But again, his slant on this typically always goes back to the social side. When I sat at the table for the first time, not even as the MLA, but just as a person going out there to meet him for the first time as a nomination contestant, got a chance to tour their site with one of the councillors and also with the chief. And the problem was, we never talked about the social side of it. We never talked about the healing lodges. We never talked about sweat lodges. We didn't talk about any of that. When we were talking about the problems out there, it was about infrastructure. They got 55 clicks worth of road. They have $155,000 a year to deal with it. They can't get ambulance. They can't get fire service. They can't get a bunch of things out there because of it. When they're talking crime, they're talking the social fabric that's being torn apart, the drug issues in Old Town. It's because they don't have the RCMP officer anymore. When I sat at the table, probably one of the most politically incorrect things to say, when we started talking about the issues, I said, I hear from the folks outside of your community that you guys are the problem, that there's a big crime problem here. There was silence, and then it was absolute truth. And one of the councillors said, we got a problem. And I think it was Mrs. Rabbit that had said at the time, Myrna Rabbit, and she says, there was a judge that came out and he paid attention to from the Stony Plain Courthouse. He said 30%, roughly, of his court load is based on folks of our community. She says, we got drug issues down here. We got bad guys. We used to have a constable. We don't have that anymore. We got the drug issues taking place. They're pulling the kids off the track. And she says it's causing all that. So then I end up talking to this judge. And sure enough, 30% of his caseload is from that community. And it's because we don't have the policing and the infrastructure there. So when we're talking about these issues, now here's the interesting thing. It all connects back down to downtown Edmonton. So when you look at these harm reduction units and these failed policies, why is it the cowboy from West Henday, that would be me, as soon as you step over the member from West Henday and you go over that little line, as soon as you get onto the Yellowhead, why is the Chinese community calling me? Why are they calling the cowboy kid, apparently, to come down to Chinatown and talk about all these issues? Because it's falling on deaf ears. When those units were going in place, they were protesting against it. They had a 4,000-person petition. They had people out there holding signs. They were not consulted with. They got steamrolled over top of by everyone involved. So the MLA from City Centre, you didn't listen to your constituents because they're reaching out to me. So let's get back to the point here. Let's not politicize this. Let's look at the broader picture. We're trying to do the right thing. One of the gentlemen's fixated on the monies. Well, we might take the monies and build a bridge. Well, how about let's build a bridge here. Let's build a bridge to fixing the problem. Let's stop talking about the minutiae and the details of managing budgets, because we all know their history in managing budgets. So let's do the right things with the dollars that we have. Let's look at the big picture. Let's get back on the bill and let's start debating that. Because we do want to do the right thing, and it's all ingenuous or absolutely genuine and in the right place. We might go at it from a different lens, but don't hold that against us, because I'll pull at all your non-consultations over the number of years. And I'll leave any time for anyone who wants to respond to that. Thank you, Mr. Speaker.
Honourable members, there's 22 seconds remaining in the time remaining. Seeing none, is there anyone else wishing to speak to Amendment RA1? The Honourable Member for St. Albert has risen.
Thank you, Mr. Speaker. That was interesting. So let's go back to the point of this, and we're talking about an amendment to Bill 16, which is Victims of Crime, Strengthening Public Safety Amendment Act 2020. And the reason, let's be clear about what this is. So this is an amendment to make significant changes to a bill, and let's be clear what this is, right? And I'm actually going to use some of the words that were released by the Alberta Police-Based Victim Services Association in a press release. So they talked about what some of their concerns were. Now, again, as my colleague said, they represent 73 police-based victim service associations right across the province, from rural communities, urban communities, whatever that means. And so they're very clear when they say that Bill 16 will see the tearing down of the fundamental principles entrenched in the original Victims of Crime Act created in 1990. So by collecting a surcharge on fines assessed for various offenses, now these are not tax dollars, that the money supports a cohort of volunteers in every corner of Alberta to be there in times of crisis and assist when tragedy strikes. So let's be clear about this, what this is. We're talking about a fund that has accumulated and grown, and my colleague spoke earlier today about the plan that was in place to address some of that, and yes, it does take time, but let's be clear about what this bill intends to do. So it intends to use this fund to pay for policing and other initiatives that they've yet to really explain to us in detail. I mean, they could talk about their consultation all they like. I think we can all agree that rural crime is a problem. That is not the issue. The issue is the Victims of Crime Fund and how it's going to be rated and used for a purpose other than it was established for. That's what this bill is doing. And that's why it needs to go to committee. Now, again, you know, the member talks about, you know, I'll pull your record on consultation and whatever. Let's talk about this record of consultation. It seems to be, let's make the changes, then we'll consult later, and weirdly enough, our consultation results will match exactly what we plan to do. That's not how you consult. You go into it not knowing the answer, and you go into it asking the appropriate open-ended questions, and you let people tell you, and that's when you find out all kinds of things. But I'm going to focus a little bit on St. Albert, which is my community, and the community next door, which is Morinville. And Morinville and St. Albert actually have their own victim service units, for those of you that didn't know. And so that particular unit will lose its funding because of this change. Now, let me tell you a little bit about this community. And you know, what I did find out is in the release or on the website of Victim Services Alberta, they gave us a range of what the average budgets are for the different size communities. And I think it's important to note that the kind of money that we're talking about on an annual basis. So the current funding model in terms of annual grants that come directly from victims of crime. So for large municipal centres, it's about $600,000 a year. For mid-sized municipal centres, it's about $300,000 a year, and all others are capped at $150,000 a year. Now that should tell you quite a bit, is that these communities do an incredible amount of work with very little money. So these grants are not huge. They tend to pay for, obviously, some training and some administrative support, but the vast majority of work is done by volunteers. The last time I spoke about this bill, I mentioned that years ago, quite a few years ago, I volunteered with Victim Services for about a year. And so I'm able to tell you firsthand the enormous amount of training that is involved, and thank goodness that that training was available, and then ongoing training to help you out, and then mentoring with other volunteers, because that volunteer work is some of the most intense volunteer work that I've ever done in my life. And you are responding to situations and supporting people at the lowest moment of their lives that you never imagined that you would be there doing that. And so I cannot tell you how valuable that training is. Those volunteers would absolutely not be able to do their jobs, do their volunteer jobs without that training. That money is going to be gone because of the changes that this government is introducing. Why? To fix another problem that also needs to be fixed. So I don't understand how taking it from one group, absolutely victims of crime need to be supported. Rural policing or addressing rural crime absolutely needs to be done as well. And it's not, I heard the member say, well, a lot of people over there are social workers, or I don't know if he counted. I don't think we have actually that many social workers. I think he likes to label us all as social workers. That's fine. But I think if you look at the research and you start to look at the problems associated with crime in communities, they are associated with social problems. We're all people. We're all social beings. That is the nature, the vast majority of crime. Whether it's problems with addiction, whether it's poverty, whether it's a history of abuse, that is the reality. As ugly as that is the reality. And so I wish that we didn't need a victims of crime. I wish that the fund wasn't so huge because of the surcharges that are levied. I wish it wasn't, but that is the reality today. And removing this money, also removing, and it's not compensation, but the little bits of money that we are giving victims of crime so that they can start to heal and find their feet again, is a tragedy. And for the government to say, no, don't worry, we'll consult, we'll figure it out. And we have to do it because we have this other problem. You have two problems. You need to address them both. And raiding a fund to pay for another, that is not okay. And this is going to impact communities like St. Albert and like Morinville. I can tell you some of the positions in St. Albert. These are the volunteer jobs. These are the requirements of the people that volunteer in St. Albert. So they have court advocates, in case you didn't know. They help people navigate the system. They help them apply for restitution. They help them fill out the multitude of forms associated with injuries or benefits. They do court prep. They actually go in with people and assist them as they go through that system. They help them write victim impact statements. They actually help them practice. These are volunteers. Victim advocates. They have to commit to one 12-hour shift per week. Some are night shifts, some are overnight, some are during the day. And every 4 to 6 weeks, they have to be available for a whole weekend to be on call, to go to an occurrence. I'm not going to describe them all. That is an incredible commitment. And for what? For the size of this community, their grant is probably $300,000 a year that pays for training and some administration, so they have a team of trained volunteers that can go out and do this work. That's just St. Albert. Morinville also has a program that deals with all kinds of issues related to, all kinds of issues in the Sturgeon County area. Interesting thing, I don't know if Morinville Sturgeon Victim Services still have, but they had an on-site certified service dog as well to assist with victims. That's the kind of incredible work that goes on in victim services. And this is a service, or this is a program that this government is deliberately stopping, but saying, hey, don't trust us, we'll consult, don't worry, everything will be fine. It's not fine. It is not fine. You have an organization representing over 70 victim services in this province, from every corner of the province, saying to the government, this is not okay. If you defund this, it is going to be a problem. I'll tell you, St. Albert has done a great job in terms of addressing a lot of, I know the member thinks it's, a little bit entertaining that we talk about the social side of crime. But the RCMP in St. Albert have actually taken that approach as well. And so they spend a lot of time and effort looking at prevention and looking at lines of communication that they can have with young people, with seniors, with people at risk. They do a lot of work, actually, in terms of prevention. And I think that we're seeing that in a lot of areas, that crime is coming down. But I did look at the St. Albert crime stats, and, it is a problem in St. Albert. And there is a reason that victim services are so busy. The stats that I could find for 2018-19, there's a 23% increase in sexual assaults. There's a 17% increase in 2018-19 in other sexual offenses. So just taking those two, not including injuries related to motor vehicles, not property destruction or crime, theft, none of that. This is a small community of I think it's under 67,000 people. that are dealing with these kinds of issues, and it is because they have a program and a service like Victim Services that they're able to do the incredible work that they do. A couple of years ago, I went to a fundraiser for St. Albert Victim Services. It was really great to have all the volunteers, and of course there are a lot of members of the RCMP as they work actually out of the building. There are members of the military. A lot of members of the military call St. Albert home. And this particular work was so important to them, and it was amazing to hear them talk about how much they valued the work of Victim Services and how important it was to them. They understand that these grants aren't enough to cover all of the training requirements, and so there's an ongoing need to fundraise. And so I find it incredible, the short-sightedness of this government to defund something as valuable. And, you know, if you're going to talk about the benefit for the investment, what an incredible benefit. You're making a tiny little investment in terms of an annual grant, and you're getting hundreds and hundreds and hundreds of free hours by trained, skilled volunteers that are helping communities at times that most of us can't even imagine. And that's really sad. It's incredibly sad to me. So some of the things that volunteers with Victim Services do, and I want to put this on the record because I want the people of St. Albert and Morinville and Sturgeon County to know that there are some people in this place that value the work of Victim Services for the small investment that they get out of the Victims of Crime Fund. I want them to understand that we are here fighting for this to keep it because we understand the value. We know the work that they do. They connect victims to community agencies, to Crown prosecutors, to Children and Family Services. For any of you that have ever tried to navigate Children and Family Services, it is not easy. It is particularly not easy when you're dealing with a family crisis. Shelters. Even navigating shelter systems in this province is not easy. Counseling. I'm sure people get calls into your constituency offices all the time, people looking for counseling, and they can't afford just a regular counselor. It is not easy to find those resources, but that's what these victim service advocates do all the time. Even helping someone navigate through a system as difficult as the medical examiner's office. I don't know if any of you have unfortunately had to deal with that office and the reports that come and the processes involved. It is not easy, but that is again something that victim advocates do. And so when you vote to eliminate this fund and to defund victim services right across the province, I want everybody to understand what you're doing, where you're taking the money from. We all agree rural crime is a problem and needs investment, but we do not agree that raiding this fund to fund something else that is as important is the right way to go. Not one bit. Not at all. You know, some of the other crimes that these victim advocates are trained to deal with, and I would like to list them because I want you to know how important the training is and how diverse the training is. Happily, in my short time as a volunteer with Victim Services, I did not have to deal with all of these situations, but I have certainly heard examples and been trained by people that did. And so sudden death happens more frequently than you might think. And so knowing how to support someone who has had someone die at home, a sudden death or suicide, you can imagine the training that is required. Assaults, obviously, that is an obvious one that happens far too frequently. Sexual assault. Supporting a family, again, through a suicide is to be able to rely on the training that you receive through these victim service units and their training and the training that is funded through the grants is essential for them to be able to do that work. And if you don't think that this is an amazing investment in our future, you're absolutely wrong. I would encourage each and every one of you to reach out to your victim service program in your community because you have one. And speak to them, ask them. Ask them what it's going to do when you remove their grant. Ask them. Ask them what your community will be like without these volunteers. And they will tell you. that is vitally important. So to hear this government repeatedly stand up and say, you know, we're doing this because we want to get, you know, we want to address these other
Honourable
issues.
member, Standing Order 29-2A is available. I see the honourable member for Edmonton Northwest has risen.
Well, thank you, Mr. Speaker, and thank you to the member from St. Albert's who, I guess, helped to us to understand the scope of what these services are. And then categorically, what I'm starting to think of and realize is that the importance of separating the funding for justice and for policing and victim services, like to have those somehow meshed together confuses the issue categorically. If you were somehow incentivizing judges and or the judicial system and police to have this fund to grow by the convictions that they might be able to achieve, and then that, because that money goes back to them, then I think there's some inherent confusion that you are creating, perhaps inadvertently, from this particular bill. And so I think that we've all learned a lot, and I thank you for helping to create the scope, both from the personal experience that the member had working with victims.
Honourable member, I hesitate to interrupt. However, the time is now 6 p.m. and the House stands adjourned until 7:30 this evening.